Good morning, everybody. Thank you for being here today. It is Thursday, March 2nd, and this is a joint meeting of the Education and Culture and the Health and Human Services Committees to take up two items. One will be a work session on the FY 23 through 28 CIP amendment, High School Wellness Center and Expanded Wellness Services. We'll have a panel presentation and hear from our great folks at DHHS and OMB, DGS, and Montgomery County Public Schools. Just as a refresher for my new colleagues and the millions watching at home, this is a really important project to the entire council. It was kicked off last year by Councilmember Albornoz. Excuse me. You were part of it too. Yeah. Councilmember Navarro and several of us were co-sponsors to really expand wellness centers through all MCPS high schools as part of our expansion of making sure we have need-based services, mental health, healthcare services to meet the needs of our students everywhere that they are. We know the model has been great. I just was at Northwood, which I think was the first one, school-based wellness center. I see nodding from my MCPS and other colleagues. And it's just amazing. I've spoken to the students there, what those programs are able to do and how those great staff are able to follow up and meet the healthcare, but also other somatic needs and refer students to other things that they need. And we know mental health is a big challenge right now. And a lot of times these are picked up in the wellness center. So we're going to have a conversation about that and then take some proposed action on, there's a pathway laid out in the packet, which we'll talk about, which I think makes a lot of sense, but obviously we'll work it through with colleagues. So before we can bring the panel up, and then I'll turn to my colleague, Councilmember Albornoz, my co-chair, from DHHS, whoever is, I have Miss Vicki Buckland, Jason Rudell, Dear, I don't see Dear, whoever's the DHHS team. Oh, there you are. You're hiding. Okay, come on up. Mark Hodge. Let's start with, and then Mary Beck, do you want to come up as well? If there's, okay, Grace. Okay, Grace, come on up. In DGS, do we have any of our DGS partners here? I don't see them yet. Okay. Oh, there you go, Mr. Assant in the back. Everyone's hiding today. And then Seth Adams and Adrian from Montgomery County Public Schools, or just Seth is fine. Okay. Great. So before we turn to you, I want to turn to my co-chair, Councilmember Albornoz.
Thank you very much, Chair Joando, and I appreciate this wonderful panel being before us today, and I appreciate you acknowledging the great leadership of Councilmember Navarro. And just wanted to provide a little bit more context because I think it's important as we go into this conversation. So we, of course, were gravely alarmed by what we were hearing, what we were seeing, what was happening across our entire school system, particularly as it related to mental health challenges facing our students in a way that, and I've been around the youth development space for over 24 years, I had never seen before. And many people who had been around longer than me said the same thing. And so there was immediate action taken in partnership with MCPS and DGS and the Board of Education and the superintendent to devise a plan to expand the wellness programs to every high school in Montgomery County. But there was also an acknowledgement that the mental health component was the focus. And while wellness centers, it would be wonderful to have a full suite of all of the services provided in every wellness center, which of course include medical services as well. There was an acknowledgement that we wanted to transition and phase this in a way that made sense based primarily on the needs on the ground and also ensuring that we spent our resources in such a way that we were able to spread those resources as effectively as possible. And so I just want our public to understand that we, of course, would support a full suite of wellness programs in every high school, but not every high school needs a full suite of wellness services. And we have to bear that in mind as we have this conversation, because what we want to do is put our colleagues, both on the capital side and the programming side, in the best position to succeed immediately and not get bogged down by what model makes the most sense, acknowledging we've got a problem before us right now. So I just wanted everybody to take a deep breath and understand that so that, you know, as we go through this packet, and it's a great packet, by the way, we'll bear that in mind. So with that, I yield back to you, Mr. Chair. Thank you.
Thank you, and I appreciate you raising that. And we will go through this great packet and the various items. So I want to turn to Ms. Yao first to tee us off before we turn to our panel.
Good morning. The Joint Committee is going to review the executive's recommended amendment for the High School Wellness Center and Expanded Wellness Services project in the fiscal year 23 to 26 CIP. This umbrella project started out placing comprehensive high school wellness centers with a full complement of somatic health, mental health, social services, and youth development services at high schools identified by need. For the fiscal year 23 to 28 CIP, though, the council expanded the scope of this project to respond to the tremendous student mental health needs, in part due to the pandemic. The council approved funding for space modifications to accommodate wellness services, mental health case management, and positive youth development services at every county high school without a full wellness center. So at this point, all high schools have these wellness spaces and services. The Joint Committee will receive an update on the implementation of Bridge to Wellness later on in this meeting. The approved project also included funding for feasibility analysis and planning and construction funding for the first 4 comprehensive wellness centers. The table on page 2 of your packet.
Ms. Yao, is your mic on?
I don't think it's working.
To the left, it wasn't working. It's not lighting up.
No light.
Can we slide you over then? Maybe. Does that one work? Is that one working? No light there?
No.
There you go.
Oh.
Is that mic on, sir? No? You weren't hearing it. All right, so we're going to need you to repeat that. Sorry for the folks at home. On now?
It's working?
The light isn't working. Okay.
Oh, okay.
To the left is on, so if it's to the left.
Okay. All
Is there a CIP amendment for the 7th floor council staff? Mr. Hassan? Okay, all right. Okay, your mic wasn't on, all right. So let's try that again.
Should I start from the top or
I think
just?
so.
Okay.
Yeah, because people are watching. I'm sorry.
Okay. No problem.
Thank you.
Okay, the Joint Committee is here to review the executive's recommended amendment for the High School Wellness Center and Expanded Wellness Services project in the fiscal year 23 to 28 CIP. This is an umbrella project that started out placing comprehensive high school wellness centers with a full complement of somatic health, mental health, social and youth development services at high schools identified by need. But in fiscal year 23 to 28 CIP, the council expanded the scope of this project to respond to the tremendous mental health needs of students, in part due to the pandemic. The council approved funding for space modifications to accommodate wellness services, that is mental health case management, positive youth development services at every county high school without a full wellness center. And at this point, all high schools have these wellness spaces and services, and the Joint Committee will receive an update on the Bridge to Wellness initiative later on in this meeting. The approved project also includes funding for feasibility analyses and planning and construction funding for 4 comprehensive wellness centers. The table on page 2 of your packet shows the anticipated implementation timelines for full high school wellness center projects during the 6-year period, with Blake, Einstein, Springbrook scheduled for construction as standalone projects in fiscal year 24 at an estimated total cost of $4.5 million each, and Woodward, Crown, Damascus, Northwood, and Magruder scheduled in conjunction with major school construction at an estimated cost of $2.5 million each. In addition, there is $350,000 of planning funds for Poolsville High School, which is currently undergoing major school construction. The executive is not recommending construction funds for Poolsville at this time due to fiscal constraints. And council staff understands that if we were to take advantage of major school construction at Poolsville for cost savings, there would need to be funding added in fiscal year 24. The total recommended amount for the 6-year period for this project is $29.419 million, and $28.419 million is in GO bonds, $1 million in current revenue. The cost change from the fiscal year 23 to 28 project is $3.419 million, and the requested appropriation for fiscal year 24 is $21.350 million. The PDF indicates that the cost increase for the 6-year period is due to leveraging efficiencies related to MCPS's existing school construction schedule and adding 4 additional high school projects to the CIP project. Also, council staff wanted to just note that the PDF should be corrected to shift $125,000 in fiscal year 28 from construction to planning, design, and supervision at Magruder High School. So that change needs to be corrected. So there are a few questions that the committee should consider before moving forward with recommendations. First, this is an opportunity for the committee to reiterate the stance of the previous council about, whether to cite a full model high school wellness center at all high schools in the county. Again, a major consideration in citing these schools is based on need and the number of students who lack health insurance or are underinsured. And again, there are new services coming online with the Department of Health and Human Services. Apparently, there will be a new mobile health van that will be in place this summer that could potentially address some of that need. Number 2, consideration is how should high schools be prioritized for receiving a high school wellness center? To what extent should major school construction at a high school factor into the timing of construction? If schools are prioritized based on major school construction, there will be cost savings associated with the timing. However, this policy would not necessarily serve racial equity and social justice goals by placing schools with relatively lower need and less diverse populations ahead of those with greater needs and diversity. There also may be interest in expanding comprehensive services to schools at other levels, including middle schools and elementary schools with high needs populations before, again, high schools with relatively lower need. And number 3, in determining the priority list for building out full wellness centers, should the Joint Committee request that DHHS perform a comprehensive analysis of candidate high schools and convene the school-based health and wellness center advisory group to make recommendations? It's consistent with this practice in the past. DHHS noted that there wasn't time enough to do this for the fiscal year 24 CIP recommendations, and that they did consider reduced meals farms and Ever Farms as a proxy for poverty and low access for health care, as well as attendance, graduation, suspension rates, and crisis center referrals. The process that council staff is referring to would be more transparent, better serve racial equity and social justice goals, and provide opportunity for key stakeholder feedback. So council staff's recommendation, at least moving forward, is approving the amounts proposed by the executive with adjustments, with the adjustment noted earlier, to retain capacity for construction of high school wellness center projects in the CIP. There's an unmet need for these somatic health services certainly in priority areas, if not all areas of the county. Request that DHHS perform a comprehensive analysis of need and convene the Wellness Center Advisory Committee to determine recommendations for the priority of schools. And again, if there is interest in not moving forward necessarily at every school, the level of need that would warrant building a full high school wellness center, as well as considering a policy for citing school-based health centers at middle schools with associated priority recommendations. If the Joint Committee recommends moving forward with a full high school wellness center at all high schools and prioritizing schools undergoing major school construction, then it may want to recommend $2.15 million to the PDF for Poolsville High School in fiscal year '24.
Okay, thank you, Ms. Yao. You gave us a lot there, which is why I'm glad your mic was on. I will tell colleagues, if you would like to speak, I think this works. Slide your thing to the right, and it'll tell me, and I will. Let's do it that way since there's a lot of us today. Perfect. There we go. I see it. Okay. So what I'd like to do, and we can, if colleagues would like to make comments now, but I'd like to let DHHS talk about, and the team talk about their prioritization. I know we just got something hot off the presses here, right, that I think speaks to this. And if you could please address the issues that are raised in the packet, because there are some kind of core issues here about the direction we take. You heard my co-chair kind of lay out his thinking, which I think makes a lot of sense, that we have limited funding in the CIP. We want to obviously focus on equity and prioritize what the needs are on the ground at the schools, but would want to hear about your analysis. So if colleagues are fine with that, or would you want to chime in now? Okay, let me first go. Do you want to chime in now, or you want to come in after? Okay. Okay, yeah, wait.
So, no, just briefly, I think that,
Mr. Mike, you did. You got it.
Marilyn Balcom, council member for District 2. One of the, representing the Poolsville area, one of the issues is the confusion between the terms. So if we're talking today, can we talk about wellness centers, complete wellness centers, medical wellness centers? I think there's some confusion, certainly in my community, about that. So when we go through, if we can clarify that. Thank you.
Okay, thank you. So, Mr. Hodge.
Mark Hodge, I'm the Senior Administrator for School Health Services in the Department of Health and Human Services. Let me start by defining high school wellness centers. So in the terms that we use, whether it's school-based health center or school-based wellness center, there's a state definition that goes with that. And that includes medical services, and in many cases dental services and mental health and social services as a comprehensive wellness center. When we're talking about bridges to wellness, that was our affectionate term for getting to a full high school wellness center at every high school, but bridging it, starting with mental health services and social services until we could build out the physical space for us to be able to also provide the medical services. As Councilmember Albornoz mentioned, from an equity standpoint and from an access to care and need standpoint, if you look at many of the high schools in the county, there isn't a clear need for access to medical services. There is access to care in communities like Bethesda and communities like Rockville, where that doesn't mean there's not pockets of poverty in those areas, but access to care is much more readily available in some of those places. But moving towards a full wellness center, and I know I keep adding to those words that make the definition confusing, but adding a high school wellness center with all of the comprehensive services that I mentioned in every high school, we decided we needed a priority list. And so when we were doing the priorities about this time last year, when Councilmember Navarro had asked for a high school wellness center in every high school, generally we would convene an advisory committee, and we would look at all of the data that's out there across zip codes and census tracts. That just wasn't possible for the quick turnaround we needed last year this time. So we use this data that we have available, as Ms. Yao mentioned, as proxies for access to care and for poverty. And then looking at the last time that we came out with a priority list in 2013, it's a little similar. There's been some changes to that, but we believe that the ones we put in green, which is priority 1 in the chart that's in front of you, those are the most needy, for lack of a better term, schools where access to care and availability of medical services as well as mental health and positive youth development services would be greatly used and And that's where we would like to put them. And so in discussing this with OMB, with the Office of Management and Budget, there was a decision that had to be made about whether we do some cost savings by putting it in schools where we're already doing construction. So Crown High School is being constructed, Woodward High School is being constructed. There's some enhancement projects that are happening at a couple of other high schools, including Poolsville and Damascus. And so looking at that and where those things might fall on this list, Crown and Woodward aren't on this list because they don't exist yet, but their location would make you assume that they're not going to be that high on the list. Crown may be somewhat of an exception because they are taking some of the Gaithersburg high school students from that in the boundaries. But that was a decision that had to be made. In order for us to look at equity and look at where we would get the best bang for our buck, whether it was cheaper to go to an existing high school construction project or where it would be used, we erred on the side of doing a little bit of both. And so the high schools where we took from the priority one list are in the CIP, as well as some of the others that are doing current construction projects, knowing that in the end, at the time, council wanted a wellness center in every high school, so it made sense to move forward in that direction.
Yes, thank you, Ms. Treadvance.
Good morning, everyone. Dira Treadvance, Chief of Children, Youth, and Family Services. I just wanted to elaborate a little bit more on the history of the Bridge to Wellness piece. Thank you, Mark, for defining that. Just historically, when we were at the table having the conversation where council had the posture of we need a high school wellness center in every single school, we knew that was going to take time, and we had our priority list. However, the charge was that there was a need in every single school. So the priority list was to prioritize from an equity lens and an equity perspective across all of these indicators, the schools that needed like a physical structure immediately right now. So Bridge to Wellness was added on so that the schools that were not considered priority could still have some sort of mental health service enhancement. So what we did is that we offered a clinician and a case manager to each of those schools. So hence the name Bridge, that is just like until the wellness center formally comes, we're going to resource you in this way so that every school at least got some form of services. So I just wanted to elaborate a little bit more on the history and the logic of how the two are connected and not connected at the same time.
Appreciate that. And to my colleagues and for folks that are watching, we will talk about the Bridge to Wellness program and what's happening and get an update on in the second part of this presentation. This is to decide on the CIP amendment and the prioritization list. So just if you could restrict your comments and questions at this point to the extent that they are related to how we should do the prioritizing, and I think, I'll just say for my part, and then I'll turn, is there anyone else who wants to speak on this panel before we turn to colleagues? No? Okay. So I'll just say for my part, I'm similar to my co-chair. I think this makes sense with what we have. I also think the point of reconvening the group to look into this as we go along and obviously make further recommendations. Obviously, when a new school comes online, that could change depending on what happens with Crown, and maybe it's different in the list. This would be, a living document, but for now, I think this makes sense with the money we have and with the indicators, we have, and just for folks to know at home, and we'll make sure this gets online. But, for example, Einstein, which is one of the schools that's in the green to be prioritized, you have things on here about the diversity of the school, the demographics, but also the farms rates, which are, 45% ever farms at free and reduced meals, Ever Farms 61%, ESOL 15%, and then graduation rate 77%, which is the lowest on this list, and that's why I pulled them out. And just as an example of some of the prioritization metrics. Ms. Yao, yes.
I just wanted to get clarification. The data that's in this spreadsheet, is that the current school year?
These are from the MCPS at a glance from the last year.
They don't.
I did this last year.
Right. I would ask that we, I think council staff needs a little extra time to look at this data. It doesn't match the data that I pulled off the website for last year, so this might be a year prior to that. Yeah.
Okay, so it's not current.
And it's not current. So, again, the farms data is not
Not correct.
right, exactly. So before the joint committee goes ahead and recommends the exact program that the executives put forward, I think it would be good to get,
To get the exact data.
yeah, and then get a little bit more clarification of how it went. Again, that's why council staff recommended approving capacity, but not necessarily the order.
Order.
And this, can we clarity on the?
Just to let you know.
Yes.
Oh, sorry. I think that every year at MSDE by September 30th is when they have the current school year's data for all the attendance and demographic data. So they should have that as of September 30th at the state level. So MCPS should have that here for you to use.
Okay, so we're going to go through, thank you, modify what I said, then the capacity of how much funding there is, we can approve that today, should colleagues agree, but we don't have to agree to the ranking. Ms. Trevance, yes?
I had just a pin, as we talk about sort of the protocols on how we determine a school or how we review the data, if we can also consider like what caveats, because we'll be reviewing the data a lot over and over, which might potentially put us at sort of retracting our decisions, which puts MCPS in a binding, in a weird of a pickle, because it's like today it's this school, tomorrow it's that one. So a caveat for us to put some parameters in place on how we review the data and at what point we say this is the data we're
Once
going
you
to
start
go.
building, you're building.
It's done,
And-
yeah.
And you're doing it.
So we should be mindful of that.
Mr. Adams, yes, and then we'll move to Colin.
No, and I appreciate that the comment. I think one element too that I would just add is critical schools like Einstein. Einstein is a school that's over capacity. It's growing. We have 11 portable classrooms. We're going to add more portable classrooms this summer. I would also say that understanding what's happening at the school level, understanding from a student impact perspective, is going to be important. So building at Einstein today may actually be more impactful than working through the process to relieve that school over the next couple of years. So I just say that because there's a lot of intersecting points on this,
Sure.
and just understanding the overall impact to students trying to navigate 15 to 20 portables on a campus and building a wellness center at the same time might actually be more impactful to those kids than just waiting slightly until we have the ability to relieve capacity or relieve some of those pressures on that campus.
More impactful in the sense of not good.
Not good.
Yeah, right, because you could think about impactful in the sense of it would be helpful. I just want to make sure that you're making the point that because they've got so much going on, it might make sense to wait. And, yeah, right, okay. Very good point. All right.
Clarify where this data is from, why it's different.
Yes, so I think that's what Ms. Yao was saying. The data, that's older.
This is older.
That's from MCPS at a
Packet
glance.
is newer.
Packet is newer.
It's 21 to 22.
Yeah, correct.
But we did not have access to this current school year,
Yeah.
at least at this point.
So this is 1 year old, that's 2 years old.
Thank you.
I'm going to start with Ms. Sales, and then we'll go with Ms. Lukey, and then if there's others, and then to Ms. Councilmember Mink.
Okay. The left. It's on the left, but the light's not on. Oh, it is working now. Okay. All right. Okay. Thank you. Yes. So thank you for the presentations and the information. My daughter graduated from Gaithersburg High School, so I have seen the benefits of school-based wellness centers up close and personal. I wanted to ask some questions about the actual data that we have on the school-based wellness centers. When I was looking in the packet, it said council staff notes that a comprehensive analysis to develop priority rankings has not occurred. Do we have the demographics of the students who use and frequent the current wellness centers, and what criteria are we using to identify the priority rankings for where the next wellness centers can go? I think looking at poverty rates alone does not fully encapsulate the purpose of these wellness centers. With the rise of mental health challenges, the rise of opioid usage, we have to take a different approach. And so my first question is, how are we evaluating the services provided, the students who are taking advantage of the wellness centers, and then how are we looking ahead to accommodate the future needs of the placement of these wellness centers?
As I mentioned, the School-Based Health and Wellness Center program is a state program. We do get currently $1.5 million in grant funding from MDH for school-based health and wellness centers. That should be coming before full council for appropriations soon, I hope. But as a result, we have to provide a lot of data to the state for each of our school-based health and wellness centers. I can provide you with better, more clear data that I don't have in front of me, but anecdotally, I can tell you that because of the placement of our school-based health and wellness centers, and just for clarity, the health centers are in elementary schools, and we have 9 of those currently, and our wellness centers are in high schools, and we have 6 of those currently. But the placement of those, you can imagine that the highest number of students that we see are Latino students, like well over 50% of our visits are from that population. And because we have Care for Kids students that are, or Care for kids that are assigned to each of the school-based health and wellness centers for primary care, well over 1,000 of them are assigned to the 15 different school-based health and wellness centers for primary care. And generally that population of Care for Kids is also overwhelmingly Latino. And so the number of visits we see for primary care, for sick care, generally is in that population. And we do have language services at all of our sites for that. The other data, the other breakdown from a race perspective for the visits can be provided.
Race, how are we fully, holistically looking at what these wellness centers are providing and how we're thinking about the needs? What are the needs of our students, regardless of race? What are the needs, the health and wellness needs, and how are we evaluating those?
Right. And so I can speak for the medical piece, and Mr. Advance can speak for the positive youth development and mental health piece for the services they're providing. It's 2 separate contracts. But we do look at and we do pay attention to what the medical needs of the community are. So do we know this particular group of students needs access to sports physicals? This particular group of students needs immunization access. So we're always paying attention to what in that school community, because it is, for our school-based health and wellness centers, outside of the Care for Kids who are assigned there, it is specific to that school. So we don't generally see students from other schools in those school-based health and wellness centers. It is a contained group. And so we are looking at specific needs in those communities in providing that medical care. We have a nurse practitioner in every high school and elementary school-based health center, and so they can provide sick care, primary care, things like that. So we're always paying attention to that, making sure that we have the resources available. We just are in the process of purchasing more immunizations for our 19 to 21-year-olds who are attending Edison and some other schools, because the Vaccine for Children program does not cover that. It only goes up to 18 years old for free vaccines. And so we are in the process of purchasing that because we know that there's a need throughout MCPS for that service. So yeah, it's something that we're always considering. Mr. Advance can speak more to the other side.
I just wanted to clarify also for the community that's watching, in terms of your first question of how are we determining the criteria of where the next center would be. So apologies, there was a bit of a disconnect in terms of what made it to the packet and what Mark offered this morning. This is inclusive of all of the indicators, which goes beyond the farms rate. And we'll be happy to sort of, walk you through and provide a list of what some of those indicators are. It goes beyond race, it goes beyond farms. We looked at graduation rate, suspension, and a bunch of others. If there are any suggestions from council in terms of what additional indicators we should be looking at that you think are priority, I'm sure we'd be more than happy to take a look at those too.
So I see enrollment here. I don't see a column for capacity for the actual school. Because I hear that some of our schools are already over capacity, so that would be something I would like to see.
What do you mean by capacity? Is that like physical space capacity?
Yeah. like-
That's what, yeah, so depending on where they rank, those are the school that will require, that's what this funding will fund, so that there could be a capital sort of construction done by MCPS to enlarge their capacity. So that will happen organically, depending on the schools that we rank.
Yeah, but what is the current capacity of these schools versus their actual attendance rate? Because some of these schools are over capacity. They have more students than the building was created for.
Are you, I'm struggling to understand, yeah.
It's an MCPS facility question, and certainly that information is available. You're right, it's not represented in this chart.
Yeah.
That is information that MCPS has, and we would
Can
have in the
provide.
capital budget, and we can connect that. As was mentioned, we just hadn't seen this particular format previous to this morning.
No. Okay.
And if I could catch you offline, I want to understand that a little bit more too. I'm sorry, after this, I just
I
want to
think
understand.
we're asking
where
about,
we're at.
she was asking, I think, about the, we talked about Einstein in the trailers, like how many schools are at capacity? And how does the capacity of the school factor into the decision?
Got it. I wasn't understanding. Got it. Because again, I'm sorry, I'm not.
We don't have that
from
data right
perspective.
before
I'm
us
looking
here.
at it from the other
Right.
social and public health pieces.
And
Great,
then
great point.
another piece of information that's missing is we hear about incidents of overdoses. We don't have that information. Any calls for any emergency services called to the schools, we don't have any information about that. And so I just want to make sure that we're fully understanding the picture of needs and what the actual needs are for prioritizing where these centers will go. If we were to expand the wellness centers into middle schools, what would the timeline for that look like, realizing that we only have 1, 2, 3? I mean, we're going to hear about the 4 for 24, but we haven't even fully funded the 4 for 24, and now we're thinking about middle schools. And so what's the thought behind that, and how realistic is that, and how will that impact the funding and timeline for the high schools that are already in the CIP?
So once we convene the advisory committee, and generally when we're deciding on which elementary schools and high schools to move towards creating a wellness center or a school-based health center, this advisory group meets and then with a lot more data than just what's in this chart, makes a decision about placement. So we hadn't in the past considered middle schools. That is something that's very important to me now, and I know to Mr. Advance as well, as we expand linkages to some of the middle schools. I know that there will be community schools, which is a state program, who will be moving towards or be in middle schools starting next year. So clearly the need is there for middle schools. It just hadn't been considered up to this point. I am planning to start this advisory group planning meetings shortly. It can't happen before the budget is finalized. There's just too much data and too many other things to consider and too many other people we have to bring in. It's not just the people at this table. But I would expect that we be able to have a much more comprehensive plan or recommendations for you and for the county executive in the fall that includes elementary schools, middle schools, and high schools moving forward.
When do you anticipate, I guess, how are you assessing the effectiveness of the wellness centers, and when can we see that data?
Why don't we, that's a good question. I think if you can answer it briefly, we are going to get into a little bit more of that in the second conversation. So maybe we can come back to it there. Is that okay? Do you have any response now quickly to that, or are you prepared to talk about that?
I can quickly talk about the medical side of it.
Okay.
So that is one of the measures that we have to provide to the state, the number of students that were seen in the clinic and able to return to class versus having to be sent home. Those who had to be sent out to the hospital through 911 as a result. So we have those measures. It's a little more difficult to say that a program is working or not working on the medical side because students come in when they're sick. or students come in when they need some other medical attention. There's not a lot of long-term care that occurs from the medical side, but certainly for the PYD and mental health side, they have other measures.
Yes.
On visits and services.
We do. So we have, our providers do collect extensive data. I do think that one of the complex things is defining what an adequate evaluation that this is working that encompasses both the social services piece and the medical piece. Because of right now, the way the model is kind of bifurcated, even though we work fantastically in concert. But I think in terms of evaluating the full scope and the full picture, I do think that is something that maybe we could go back and give a little bit more of a thought to look at the holistic instead of separating these services are working in this way, these services are working in that way, but what is the story of the collection of the services doing? I think that lens is one that we need to apply.
Any student that accesses these services, what is their experience? How are they walking away? Do they feel like they got what they needed? Those sorts of exit surveys would be helpful in ensuring that we have a full picture of the end user's experience in each of these facilities. Thank you. I yield for now.
Thank you. Yes. Councilmember Lukey.
And I know we're focusing on the capital budget right now, but I'm going to have to scoot out of here in a moment. So I might be putting something out there that you'll talk about when I'm not here, but I'll get to listen to it later. So I do want to say that I fully support the county executive's recommendations before us, and I want to thank all of you from the prior council for pushing this issue forward, because this is something that's been near and dear to my heart for a long time in my prior work before I came to the council. So this piece that I'm about to ask about goes more to the operational side, but there's a lot that we could do to make the wellness centers even better, and for those that are going to come online in the future to anticipate doing this from the outset. We have an operational roadblock right now where school systems are not permitting students to access telehealth in the school building. They require a parent to come and sign them out, even if it's a telehealth appointment. So then they have to go outside and sit in the car with mom or dad and do their appointment. And if it's a therapy appointment, a parent typically wouldn't be in the therapy appointment with them. So that's creating all kinds of other logistical things. And then that increases the amount of time the student has to take away from class in order to obtain their therapeutic services. And we all know that therapy appointments are in short supply. So if you've established a relationship with a provider, you want to take the appointment when you can get it, right? So there is a state bill pending. I testified on it yesterday, House Bill 878. That would allow for middle and high schools for students to be able to take their telehealth appointments on school grounds, and does not mandate any construction of a special room or facility. But since you're building these and since you're adapting these, I want to make sure that the plans are agile enough to help accommodate that when needed, so that we're doing our very best to reach as many students as possible. So just wanted to put that out there. I know you all will talk about that and can discuss that further. I know that there are contracts for therapeutic services for providers that MCPS engages to provide services on site, but still that's not enough to encompass the full range of needs that our students have. And obviously understood that teletherapy is not appropriate for everyone, but it is appropriate in a very high percentage of particularly our adolescent population to meet their needs. So just wanted to put that out there. You all can discuss it later.
Great point. Thank you, Councilmember Lukey. Councilmember Mink.
Thank you, Chair Jawando. Thank you all for being here today and for this great information, and to our staff for a fantastic packet. I have 3 questions. My first is on Paint Branch High School, which is, of course, right up there in our needs list. And so it has the second highest farms and EverFarms rates of schools who are missing wellness centers. And so I just wanted to understand why it is not on our list here. If anybody has any ideas on that.
We know we couldn't do everything. We did Everything else being equal in the priority list, we then looked at locations of where we have existing wellness centers and where we're missing them. So the East County certainly was, well, we just opened Kennedy, that's not as east as we go. So looking at Springbrook, at Blake, to make sure that geographically we were also making those considerations. It was just, there was no specific reason why Paint Branch wasn't chosen. It was just a decision we made, knowing we couldn't do all the schools at the same time.
Thank you. So I do have some concerns with that, because the reason that we have them, so many in East County, is because the needs are so great. And so to say that I don't think that geography should trump that. Open to hearing other thoughts on that, but that does not make a ton of sense to me. These are serving the students who are in those schools. Students aren't going to other schools to get served. And so I have some real concerns about that. I don't know how much ability or capacity we have to do something about that, but if the advisory task group that has been convened previously, as has been mentioned, I don't know, is geography something that they typically take into account? Do we know?
Up until now, no, because that's why
Okay.
where we are for elementary schools and high schools generally is down county, Silver Spring area, Wheaton and in Gaithersburg, Germantown. So it's kind of that corridor. We hadn't considered geography before that. Now that we're expanding to all of the high schools, we decided we needed to have geography be a consideration because, at least in the priority list, because we didn't have them necessarily as much in the East County as yet as we wanted.
Okay, so I'm interested to hear from my colleagues on this as well. I will say that my thoughts on this are that, when we look at our school-based centers, that we should not be taking into account geography for the reasons just stated. Students are not going to other nearby schools to go to those school-based wellness centers. So I think looking at the other metrics is what makes the most sense. I do think that it should be taken into account as we, as a larger body, are looking at where do we have health centers available to the community, and making sure that we have, health centers that are available in community centers and that sort of thing. But I do not think that that is something that should be impacting where we put our school-based centers. And I think that also that might be part of our conversation when we talk about Poolsville as well. I will mention that I absolutely think, as has been discussed, that looking at need is, and our other indicators here is really important, and having the priorities be based on that, which is why I think that Paint Branch should be on this list. That said, I do have some concerns about delaying Poolsville or another situation where we do have a new school being built, because it's the cost there is going to be differential, is going to be significant. Not only if we're looking at it now, I guess that would be a $2 million differential, but over time we can assume that will be more as costs may continue to increase. I also don't want to deprioritize our high need areas, and so I think that is good impetus for us looking at how we could where we can find that additional funding, or how we can create that additional budget space for ourselves. Because I think that would be, more responsible in terms of what we're doing with taxpayer money. But again, I absolutely agree with priority rankings, as has been discussed. Okay, so my last question is on the procurement and contracting processes and speed thereof. It has been slow. A couple examples: Bridges to Wellness. The county made the special appropriation, I think, in May 2022, but when they opened in late August, none of those were staffed, is my understanding. Many were still unstaffed in December. I know we're catching up now. Kennedy High School, that wellness center just opened, of course, on the 27th, but only on the medical side. We have no mental health staff. And my understanding is that's also because of the time that our procurement, our RFP process takes. So a couple questions. Is that a county-wide problem that we're having across agencies, a full system-wide problem, or does each agency kind of manage its own process and have some flexibility? What is the solution there, given that completion dates for things, like the Kennedy wellness center are known well in advance, why can't we ensure that these other pieces are keeping up? And especially in a time of crisis like this, do we have the ability? It sounds like some just fixing needs to be done of the systems, but also do we have the ability to expedite this process when we have, crisis situations like what we're facing now?
I can't speak on the county-wide perspective. So I don't know I don't know that anyone on this table might be the right person to respond to that. Okay, perfect. There she goes.
I'm not Mary Beck with the Office of Management and Budget, and I am not representing procurement, but I will say throughout county government.
I'm sorry, I just want to make sure your mic is on. Are we good? Okay, great, thank you.
Throughout county government, there are a number of factors that are causing delays in these situations. Many departments have vacancies. So it may not just be vacancies in procurement, it may be vacancies in HHS or vacancies along the way. I do not know if this is another factor, but certainly I think you read the newspaper and there are shortages of therapists and medical staff around the country. So I'm assuming that that can also be contributing. So, I know that the administration has been trying to meet with big departments like HHS and with our sort of administrative infrastructure departments, procurement, finance, OMB, those kinds of departments, to see can we do better in trying to boost those services. But I will say the vacancy issue is a challenge.
Thank you. I appreciate that feedback, and I hope that we can continue to work on that together, because obviously we're putting a lot of thought into how fast we can get these things built, but if we don't have the staff, then there's not much point to that. And I think we do want these things open as quickly as possible, but they need to be functional for that to make sense. So thank you.
Thank you, Councilmember Meg. And I think to the point of the action we're going to take today, approving the funding, realizing we're going to need to come back on the prioritization. And, unlike MCPS operating budget, we do approve the CIP project by project, right? So you speak to that.
We do. I do want to just clarify that this project is in the county government. It's not in the MCPS CIP. MCPS executes.
Right. So right, exactly.
But it is
it's in the county government. Yeah, that's right. It's not so
right on both counts, but it is also
yes,
in the county government.
Right. Okay, good. And I just wanted to say before I pass to Councilmember Balcom, the issue about Paint Branch stood out to me as well. I think as we're reevaluating and looking at the most current data, I do think we need to factor that in. And so just to our DHHS partners and MCPS partners and all of our partners, let's make sure we're having further conversations about that before you come back with a prioritization list. Councilmember Balcom.
Thank you. So I have some specific questions to Poolsville and then more global. So can you tell me what does Poolsville currently have in terms of the wellness center, and are there any changes expected outside of the full wellness center for the new school?
So currently, the Poolsville High School project is one of the recipients of the Bridges to Wellness, so they do have space in the building for that bridge element. As part of the overall new construction, it does not currently have a wellness center as part of the design. So I think today, again, that was part of the recommendation, is to fund the design and that to be ultimately included in the overall construction of that project at a later date. The one challenge, and I think this is really, really important, is that as we are building that out, one of the things that we routinely talk about is the connections within the building, with the location of these centers. And when I do think of schools like Poolsville, I think about the timing. I think about schools like Einstein, the decisions that we need to make based on the timing of where we are in the overall construction, where we are in the overall relief of campuses is really important, because the decisions that we'll have to make at this early design element, you work with what you have and you end up placing these spaces in locations that are readily available. So Poolsville, if we know now and we can start designing, we can incorporate it into the overall new building aspect of it. But if it does delay from construction, we're going to have to make different decisions around, where it ultimately ends up and how ultimately it's built over a course of period of time.
So if we lose the full wellness center, then we lose the bridges as well? So I'm sorry, that's the confusion. But will the new high school have the bridges space for the bridges component? Okay, I'm sorry, I thought you just said that it wouldn't go forward.
No, so everything that the high schools currently have, particularly like Poolsville, it's in a temporary location. It will be impacted during construction, but our intent is to recreate the Bridges to Wellness space during the construction process.
And it will be in the new school, and it will be open when the new school opens, the Bridges to Wellness program.
Yes, it's open today, and Poolsville is a complicated one where we transition spaces over a course of time, but it will remain open throughout the duration of construction, and it will end up in a new location, during the course of construction. But there will be no impacts from today to when we ultimately cut the ribbon on that particular.
Okay, great, thanks. And then just curious about the school nurses. I know there's a shortage of school nurses, but there's currently a school nurse or a shared school nurse at Poolsville?
Yeah, we have a nurse at Poolsville High School. We have a nurse that covers Pool Middle School and the 2 elementary schools. So yeah, there is a nurse, a long-serving nurse at in both assignments in the Poolsville area.
Okay, thank you. And then from the global perspective of, I understand the priorities, and there's certainly a compelling case given the priority list that Poolsville does not have the same characteristics as the priority schools on the list, and I accept that, appreciate that, and thank you for your work in doing that. Poolsville is a unique case in the access to care outside of the school system. So it continues to be on the top of the list for health disparities. Even though the medical aspect of the wellness center within the school system would only serve a small sliver of students, it would help with those health disparities. But I understand that this may not be the time for this to happen. So I wanted to talk about 2 things. One is, can we look at, I'm looking at Greg, can we look at health services in another area, with the community center? Is that a possibility? But before you answer that, I think that from the committee's perspective, and I don't have a vote on the committee, and thank you for welcoming me today, the question of whether medical services are going to be included in all schools, I think today that answer is no. What I'm concerned about is if that answer turns into yes next year, we've lost the window of opportunity for Poolsville. So I think that the decision that's being made today is really a much bigger decision of are we including medical services at all schools, or are we not?
And I think that, just if I could chime in to you, there's the question of full medical services, right? Because there are some level of, obviously the school health nurse is a level of medical service, but to your point, are we doing the medical side of the school-based wellness center at every high school and taking advantage of, because I think the idea is that one day, yes, right? But depending on, a long future ahead. Mm-hmm. But I think right now, with the resources we have, the decision is we need to base that on need in the community.
I guess a question I would ask Mr. Adams that connects to this, in the bridges spaces at a place like Poolsville, what is the type of, say 10 years from now, the school is built, and how would you factor that into maybe down the line there being some change? How would that work? What's the level of effort required? And that's a hard question.
No, it's going to be very site-specific, site-dependent. And, so the bridges to wellness spaces are really, I would just give you a ballpark, around 1,000 square feet. And when we transition to a full wellness center, you're talking about close to 4,500, maybe 5,000 square feet. So the scale is immense.
Completely different. Yeah.
What we will look at in every one of these schools is, can you go in and take space from an existing portion? Is it better to take classroom space that's adjacent to the nurse's office or adjacent to the counseling suite, and then build classroom space somewhere else on campus? Those are all the things that we will ultimately look at, but there are always constraints, and I think the adjacencies aren't always going to work out in every case, but it is something that is really complicated, and it is, unfortunately, is very school specific to every situation.
Mm-hmm. Which is a good segue to whether we can do something co-located.
Sure. Good morning, Greg Austin, Department of General Services, and I know that Mr. Hodge has some comments as well. But suffice to say, working outside of the wellness centers in this particular program, Department of General Services, in coordination with the town of Poolsville and more specifically the Fair Access Committee, has been working on development of a program of requirements for a community facility. And I can tell you that we've wrapped up most, if not all, of the stakeholder interviews. And I can share with you today, and this is obviously a topic of discussion for a future work session probably, but the issue of healthcare availability generally has come up in just about every one of our stakeholder interviews. So again, outside of the High School Wellness Center and the school project that Seth has referred to, so we will likely be back once we have developed an approved POR sometime later this year to see where we want to take the next step as it relates to fair access. So there are concurrent paths, and we are well underway and working on that as well. And that is, you'll see that later in the CIP, in our facility planning CIP, Poolsville Fair Access.
Thank you. And then we talked briefly about do we make that decision and move funds over to the health center, the community center?
Yes, thank you. And so I am understanding from what Mr. Austin said that the funds for the center are in facility planning.
The funding for program of requirements development is in facility planning currently, and so that's underway. We have a team working on a POR. Once that's completed, we will circulate that for approval to the various county departments and ultimately to the Office of Management and Budget. And then we will present that to take the next step, whatever that is.
So I think that then, in that case, that is probably a future action then for
yeah, we're probably next CIP cycle for that.
Full CIP.
Yeah.
And my co-chair reminded me and us that the previous council added that program of requirements because we all understand and agree that Poolsville needs that kind of access for healthcare in the community. So I think a different conversation, but important to bring up. Mr. Hodge, and then we're going to turn to my co-chair.
Sure. Just real quickly, as a reminder, the council and county executive in the FY23 budget did provide funding for a mobile medical van. And the reason for that was because of the need, the access to care need in Poolsville. It's a drive to get to physicians' offices. So Public Health acknowledges that. Our van has been on back order. We have gotten confirmation that it will be here this summer. We've already put out a request for a nurse practitioner to be on that van, and I expect that Public Health will be providing services for any resident in the Poolsville area who needs access to care.
Thank you, Mr. Hodge.
Can I just add one other comment too? And I appreciated how you wanted to understand what we're talking about so you can go back and talk to the community, because The reason the mobile van came about was as we peeled the onion on the Fair Access folks' request for the health services, you know, the high school wellness center was definitely not the model. You couldn't get in there all the time. It wasn't open to the general public. A lot of what they were talking about was older people losing their family doctor who'd been there for years and years. And so the mobile seemed much more appropriate to getting to the real need. And part of the factor was not just, yes, we're missing a window of cost savings potentially right now on the capital side, but we might have to then be staffing a center that would be underutilized compared to others. Right. And that was, so on the operating side, you'd be wasting money or relatively less efficient forevermore.
Yeah, I appreciate that, and thank you for your time with me. And I just want to make sure that remind my colleagues that next year when we talk about the the community center, that we remember this conversation.
It's on the record.
Yep. Thank you.
Thank you, Councilmember Alvarez.
Thank you very much, and really appreciate my colleagues' thoughtful questions and comments. I wanted to highlight a couple of points because I think they're really important. One, I appreciate Councilmember Sales bringing up the issue of middle schools. I know on the ground, our street youth, our youth workers have, we're all seeing this, we're all feeling it. Councilmember Jawando and I just last night participated in a panel discussion with the Commission for Children and Youth, and there was a middle school panel, and the types of issues that we're seeing are frankly not that different than what we're seeing in high schools, with vaping and substance abuse issues at much younger ages at an alarming rate. So I'm glad to hear, and I really appreciate, Mr. Hodge, that the administration is focused on this as well, and I do look forward to you all coming back to us in the fall with a plan on how we can start phasing in middle schools into the wellness model, because that clearly is important. Second, I want to appreciate the comments of my colleague, Councilmember Balcom. Couldn't agree more. I'm sure all of us here agree as well. There are stark health disparities in Poolesville because there isn't a public health infrastructure. And that has occurred over some time. And I do appreciate the efforts of the Department of Health and Human Services with the mobile medical, but we do need a long-term solution. And I was prepared to support the adding of the design elements for the new high school, but I agree that a more holistic model that serves more of the community makes more sense economically, but also just from a public health standpoint. And that is what we, consistent with what we have heard as well, our older adult population in particular needs additional services in Poolesville. And I look forward to supporting that when it comes before us. I do want to sort of, and Chair Jawando and I were talking about this, and we've discussed this, but just to be absolutely clear, what we want to do is prioritize the full suite in the priority schools. We need to discuss Paint Branch, I agree. That absolutely needs to be part of the conversation. But doing that will allow us to better be able to implement the mental health suite of services in all schools, which absolutely is lacking. And while we'd like to get to some point where there is the full medical suite complement of wellness as it's defined by the state in every high school in the county, we also have to do a needs-based approach, as we've discussed many times here in this session thus far. So just want to be clear that is something I support, and I'm hearing general agreement from my colleagues from both committees. But we've got to give these incredible folks direction because they've been tying themselves in knots trying to figure out how to make all of these spaces work both in existing schools and future schools that are upcoming, and we have to level set expectations for everyone involved, and just to make council's direction here clear. Ms. Treadvance.
I just wanted to offer to that if we dig a little bit deeper on the data, and thank you so much, because there were so many pieces that I had never thought of for us to consider in the prioritization list that are connected to equity. And equity means that not everyone's going to get the same thing. So I just want to, as part of this conversation, in considering locations, different high schools, and as we expand to middle schools, the intervention doesn't need to be the exact same one. I don't want to box us in because of what we have in the table, but I think we also need the creative sort of to leave a little bit of room for flexibility, which was what Bridges offered, right? Since we can't have a physical wellness center in every single school, how could we resource in an innovative way to still make sure children had services? If we could still also, as we go through this, continue to leave that window open, because I think our intervention needs to be informed by exactly what the need is, to your point. And it might not be a full physical wellness center, even though that is ideal, and we could still aim for that, but just different interventions for different needs and for the specific, and also let's not forget that the developmental age of the population we're trying to reach should also be considered in an intervention that's receptive to them as well. So just wanted to.
Absolutely. You said it better than I did. And that's what I was trying to say. So I yield back to you, Mr. Chair.
Thank you, Mr. Albornoz, my co-chair. So I think what I'm going to try to restate what I'm hearing here with staff's help, that we will approve the overall amounts, but that you will come back to on the prioritization based on this conversation. The one question I have is, in light of this conversation, do we want to keep the planning money for Poolsville in there? Does it still make sense at this time to do that? If I'm throwing a curveball in here, I'm just saying to what was just said, and we have a tight CIP, so yes.
I think that, good question.
Please.
Is it on?
I want anyone who has a thought to chime in. Yeah.
I think staff's suggestion would be that, so we're hearing clearly the direction from the committee. We can work with stakeholders very quickly to bring back that priority list and present options to the committee, perhaps in connection with the operating budget discussion. And that way you'd be able to decide how far the overall funding amount would go in various scenarios. Not a ton of scenarios, but again, reflective of this conversation. And hearing that the Poolsville money may ultimately be in another location, but needing to understand first what the implications would be of a reallocation.
Well,
does that work?
It does work, and I just want. So it sounds like you're saying we will consider that when you come back, and before we pass the final budget, we can potentially slot that. I just want to throw that out there. If we're going to put it in for the community base, it probably doesn't need to be here. We're just going to say right now, we're going to deal with the mental health side in the schools and then build the community center later. So, Mr. Adams.
No, I was just going to offer up too that there is always opportunities for us to work together between schools and DGS, and if that money is there, we can do parallel studies, and then ultimately make the best decision on what those studies represent.
Yeah, I would also add that the money there is for the $350,000 is there for the design of the high school wellness center. We're not quite sure, because we don't have a finished POR yet, how these intersect and how they may overlap. And so Mr. Adams and I are in close coordination with our respective teams working on both efforts at the same time. So I don't think it's throwing good money after bad that we won't be duplicative here. We just like the opportunity to compare notes a little bit closer and then come back with a recommendation as Ms. McGuire has suggested, and maybe flesh it out a little bit more for the committees.
That'd be great. Sure. So we'll approve the amounts as proposed, and you'll come back with some recommendations before we wrap the budget up. Does everyone agree without objection? Okay.
And
yes.
Could I just add one more item that I think might be beneficial, is that I heard a bit about middle schools and high schools. Einstein, Newport Mill actually have a really good opportunity for us to think about a different model. It's the same basic campus. Is there an opportunity for us to do something that is cost effective, but has a much greater reach between both the middle school and high school level? So that might be a great opportunity for us to not to overuse the word bridge, but bridge, some of the needs of the middle school and the high school.
We love bridges, we love coordination, we love wellness. Go, Councilmember Macon, then I'll go Councilmember Sims.
Sorry, one other question that I forgot to ask. Did we address, so council staff had noticed a possible discrepancy which is noted in the packet, that there is a line item for planning, design, and supervision, or for PDS and feasibility. which is $3 million. But then there's also line items with each of the individual projects separately. Is there, by any chance, a doubling up of funds and we miraculously have more money there? The line items, I think, if you add up the different line items across projects, it came to a little over 2 million. Is that the, thank you.
I think we'll need to get confirmation from the schools and we can bring it back. But it was my understanding that the initial money was for feasibility assessments and that the money that you're seeing with the individual projects is for design for those projects. But we can confirm that for you. I would love to have extra money too.
That would be great. Okay, great, thanks. So really that line item you're thinking is probably should more accurately just say feasibility, not PDS and feasibility. So. Gotcha. Okay. Thank you.
Councilmember Sales.
Council members Balcom and Mink brought up two good points about the Up County and the East County and making sure that we also take in to account geographical considerations. Can we also include that on the next breakdown of prioritizations where the school, which region, if we can use the Office of Community Partnership region, 5 regions to identify, that would be helpful. Thank you. I yield, Mr. Chairman.
Yes, I just to confirm, I think I want to make sure you get what you need, Councilmember, but the points that I think we were making were that we shouldn't consider geography we should consider the need. But it's always good to know the geography, I think. So,
yes.
Yeah. So obviously, we want to know that. Yeah.
And certainly, all things being equal, so there are 5 greens on the chart. Those are the top priority. Edison, I've already incorporated into Wheaton. They're co-located more or less. So anyone who's at Edison can now go to the Wellness Center at Wheaton. We had enough money for 4 schools, and so it was truly, just if you look at graduation rates and attendance rates, Paint Branch fared better than the others that we chose. If coming back with a priority, I can say, sure, Paint Branch instead of Springbrook, but I have no good reasoning for that either. And so these were not chosen, the greens were not chosen based on geography, but based on the data that's here. So it's the greens are the greens. Those are the top priorities now. If we want to switch out Paint Branch for one of the others, it means nothing to me. We just had to pick ones that were fit within our budget.
Oh, good. So, yeah, not necessarily geographical needs, but like you said, some students can go to the Wheaton one that's already, set up. And so just wanted to find out more about the resources that are currently available in some areas versus those that are not. Thank you.
I think Ms. Trevance talked about looking at some other potential factors as well. So, all right, we look forward to that. Any other comments on this portion? Okay. And thank you, Councilmember Balcom, for joining us. I want to make we have our board member, Lynn Harris, here. Thank you for being here, as always. Who's doing the update? That's a new group, right? So thank you for this panel. You're off the hot seat for now, but except for Dira.
Most of it.
Yeah.
Thank you all.
Thank you. All right, so we're going to move on to our next item, which is an update on the Bridges program, Bridges to Wellness, BTW, and other mental health supports for students. And we have Luis, Dira, you're going to cover for Luis, who's sick. I saw him over the weekend, and he was sick with a mask on. Kirsten Anderson, linkages to learning. Mark, are you sticking around? I saw him run away, so.
I think he's leaving.
Okay, so we won't have Mark. And then, is there anyone else? Damon? Is there anyone from MCPS? There you go. Come on up. Yeah, come on up. Thank you. And do you all have a presentation, or are you just giving verbal updates? There's no deck or anything.
I did not
Okay.
get a slide deck.
Okay. So I'll turn it over to whoever's going to start.
Yeah.
Bridges, yeah. Or do council staff have anything you want to add?
Just that the council understood the great need for mental health services in the community and responded by adding significant funding for a new wellness center at John F. Kennedy High School, as well as $9.2 million to expand mental health services, case management, PYD, at all of the schools without a wellness center. And we're going to get an update on Bridge to Wellness and how that's going. Also, I just want to add that we had gotten some updated information from MCPS yesterday that was distributed to council members, but I also gave you a copy of that, a hard copy this morning.
Yeah, and obviously a huge commitment for us. As Councilmember Robert and I said, we were on a youth town hall last night. I asked a question to the youth about mental health services, and I think a lot of students jumped up to answer, and to say that they're in need and there's not enough, and we know that there's a huge need here. We also funded things like therapeutic health, therapeutic rehabilitative services. So eager to hear an update and how we can support. Thank you, Ms. Treadvance.
I am joined by Kirsten Anderson. I'll let her introduce herself formally, who will be providing an update for us.
Good morning, everyone. I'm Kirsten Anderson. So Administrator for Linkages to Learning in School and Community Youth Services, which Bridge to Wellness is under. And I was at the commission. I'm on the Commission for Children and Youth, so it was lovely to see both of you last night. I'm glad you got to hear the answers that were provided. So update. Bridge to Wellness was a massive undertaking. We don't normally, staff up 19 schools in such a short amount of time. I know there's been some questions about procurement and starts, so I actually want to give, we have lots of detailed tables in there, but just a summary of it. So even though the money was appropriated in May due to procurement and different things of going through the process of contracting, we added it to an existing contract so that we didn't have to go through procurement and an RFP, which would have taken a really long time. So adding it to existing contracts by September 1st, 46% of the staff were hired and on-site and working, and then by the end of September, 74% of the staff were on-site. So I know there's been talk that it was not started or not staffed, but it was actually by the end of September, 74% staffed at the sites. And by the end of October, it was 84% staffed. One of the amazing things the contractors did is actually the hiring of the mental health support staff. They were all in place except for, I think it's 4 schools by the end of September. It actually took them a little bit longer to hire the care managers, which is essentially case management, that people are not cases, so it is care management. A little bit longer to hire the care managers and the youth development specialists. They actually got the mental health staff in there faster than the rest of them.
But just so we're clear, I understand what you said. 84% staffed by October 31st. And you said there were 4 schools, though, that didn't have staffing at that?
No, so by the end of September, all but 4 schools had their mental health. So
mental health.
Yeah, their mental health staff there.
Got it.
So there's 3 positions. There's a mental health specialist, there's a care manager, and there's a youth development specialist. So of the 19 schools, 15 of them had their mental health specialist by the end of September. And really the month of September, a lot of it was just kind of getting oriented and educating everyone about it, about the services that were being provided there. So as of today, they're 95% staffed. There's only 3 positions that are vacant across the whole thing. Yes. Yeah. So in the rollout, in kind of the scope of rollout, it's been amazing, sort of how quickly we have been able to staff up. The contractors who are providing this have been able to staff up these 19 sites and provide the services. We have the referral numbers in there. Obviously, the first quarter, which goes through September 30th, the referral numbers are going to be low. Again, it was the first month of school. It was really just starting to educate the students, the staff, the counselors, the principal, and getting some of the staff in there about what this was. Second quarter referrals increased, and then we had referral data through February 10th of the third quarter. So in second quarter, there was almost 500 referrals, and not even halfway through the third quarter, we're already at 324 referrals. So those are referrals from the school, but also students and families doing self-referrals, which, them going to Bridge to Wellness and saying, hey, I'm really interested in your services. Can I participate? So definitely it's been increasing as we've gotten the word out more to the schools and really engaged the student body and the school teachers, counselors, and faculty about it. Big picture, yes.
One thing I do want to, I'll pause there if there are any questions. I just wanted to sort of offer that one of the things, it's still very soon, again, given it hasn't been that long since services have fully launched, so we don't have a full picture of sort of limitations and challenges, but some of the ones that we are being mindful of is just how could we increase the referral flow? Because we obviously know that there's a need, and, you know, working with MCPS to kind of figure, because MCPS is also very richly resourced, and there's a lot of other services, and trying to get a better understanding of what the process is, of how the determination is made from, to refer someone to Bridges versus some of the other services at MCPS. So we're still at the table coordinating some of that, because what we've heard from some of the providers is that obviously hiring clinicians is very hard. And a lot of them, depending on where they're at in their licensure, accept roles like this because it helps them get their clinical hours. And if there aren't sufficient referrals, it starts to turn, there's turnover. And we want to avoid that as much as possible. So it's still too early to look at full trends, but it's one of the caveats we've been working with MCPS about, so we could try to get ahead of it before it becomes a full issue.
I appreciate that, and I turned to our MCPS partners. It was going to be one of my questions, and it's a good segue. You know, obviously in these schools that we scaled up, there are MCPS-based services that, you know, whether you have counselors or school psychologists or that are, you know, and how that is interplaying. So if you could speak to that coordination at these sites, but then also the issue about referrals, like what are you all doing? Because from my perspective, and I think colleagues would agree, and you all would agree, there's no shortage of people who need access to these services. It's just how are we making sure that people know it's available, the students know it's available, families know it's available, and that we are getting them into the pipeline. So if you could address those two questions. Introduce yourself.
Yeah, of course. Damon Monsileone, Associate Superintendent in the Office of School Support and Wellbeing with Montgomery County Public Schools. And I have next to me Ms. Hope McGuire, who's a program manager and essentially partner in crime over there with Kirsten Anderson, and they are joined at the hip and coordinate these services amongst both of our agencies. So yeah, talking about implementation, really, I think there's a larger umbrella here that is raised about implementation, and certainly the awareness of the program, as well as some of the referral barriers are two of the big rocks in terms of implementation. So, you know, we have undergone a number of practices to really bring our folks together, and Ms. McGuire can speak to that, but we had the joint meetings between our Bridge to Wellness staff and our MCPS staff. I believe one just occurred the other day with professional learning to troubleshoot some of these issues and bring them from the 19 schools to a central space. What we found early on in terms of awareness in our school communities was that due to the kind of staggered implementation, right, the staffing that came in over a period of time, and with some of the high schools having their space built out, right, starting in June and really right up until school beginning, that we did not have a uniform way, right, to share this information with school communities, right. So there was not a protocol. And that was a missed opportunity, and that we are working on for the following year. So in other words, best practices to our principals. Here's how you address this at back to school night. Here's how you share this information at your opening meetings with your students, right? Here's how you share this information with your staff. Here's how you integrate the Bridge to Wellness staff into your larger school community staff. So this happened, right, in isolation, depending on the leadership of the principal and the vision they had, and we had to do some retrofitting there to get this information out. There are great examples of schools that are doing this. I have been visiting all the high schools throughout the year. I was at Winston Churchill yesterday, for example, and increasingly, the Bridge to Wellness programs are becoming highly visible in schools. They're running, they're participating in staff activities. They're coming to staff meetings. They are in their locations are such that students are starting to come during lunch for some of the youth development sessions and open sessions they have at lunch to attract students. So it's taking a little while to get the word out. We've had several different meetings and conversations with parent leaders, PTSA presidents in a variety of schools to address some of these concerns and issues. Kirsten has been side by side with us. We had a really fruitful meeting last week about the referral process. And I will just say from our lens, one of the challenges has been that we have multiple contractors, right? And each contractor has a different referral form or process. And some of them are, there are language concerns, right? There is a length of text concern, a complexity and there's also some, we've been working with some of our families and some of our communities on the stigma, right, of elevating your child for service, mental health and well-being services. So all these things are happening right now, and we recognize this, and we've had a really fruitful partnership in working through them. I think in terms of the referral process itself, there are some key actions, right, that just came out of a space that we had last week. And one of the things that we really would like to work on is ironing out. It seems like a small thing, what I'm about to say, but it really would, I believe, would open up a gateway for students to access these services. So we're trying to figure out how, say, for example, some students, right, in some schools are able to go to the youth development lunch sessions. We're playing basketball, we're playing video games, it's an open session. Come on in, get to know our staff, low risk, right, just a friendly environment. And these types of sessions have been up and running at our wellness centers for a very long time. If you go into Watkins Mill, if you go into Wheaton, you will see those spaces flooded with students who are just there because it's a safe, welcoming space. And they may also access the other Tier 2 and Tier 3 services. So we really want to figure out a way to make sure that there is not a high barrier referral process. Like, you don't have to necessarily get a permission slip from your parent just to participate in these just settings, right, where kids can feel welcome, they can feel warm, they can get to know the staff, and then after that relationship is made, access services at Tier 2 and Tier 3 level that may be required. So that's a key step right there. I could speak a little bit more at a global level. Ms. McGuire can speak to some of the details about the referral complications that we've had, and also to some of the communication with the larger school communities as well, because she's working on this all the time.
Do we have those? Yeah, go ahead.
Sorry, just want to clarify one thing, not so much the referral process, but the consent process.
Yes, sorry.
Sorry, so I just want to clarify.
Yes.
The referral process is actually the same at every school. So it does go through the school's well-being social worker, who's the MCPS employee, who is the liaison with our Bridge to Wellness team. Every school has a standard spreadsheet that they use that is used across all of the schools. So we do have a standardized process for how the school makes the referral to Bridge to Wellness. And then also if the student or family is referring themselves, so maybe it didn't come from the school counselor, it's the student who walks up and says, I'm really interested in this, that also gets documented on that spreadsheet so the school can be aware of it, so just to avoid any duplication of services. So it is pretty uniform on the referral process. It's the consent that you were talking about. That each of the agencies do have a different consent form, and there's different links to that. And that's been more of the conversation.
Yes.
Has been the consents to be able to start it, because again, parents have the right to know what their child is receiving and what those services are, and so it is getting the consent from the parent guardian for those services.
Thank you, and thank you for that clarification. Absolutely, as not an expert in clinical services, but as a lead administrator. So yes, absolutely. I was speaking about consent. As Kirsten said, the referral process is uniform, and again, Hope can speak to that. But generally, the students are referred, and we spoke about this I think a few months ago. The students are referred to our student well-being teams, which comprise all of our school-based mental health and wellness professionals, your counselors, your social workers, your PPWs, your special education resource teachers, your administrators, so on and so forth. Students are referred from really any staff member, and this could be for any number of reasons, whether it's disengagement, attendance, manifestations of potential wellness issues. They're referred to the student well-being team. They are triaged there by this team of professionals, and then we have a menu of interventions that we can provide for the student based on the need, and one of them very well may be the Bridge to Wellness program. Our social worker is the key liaison for that program, and he or she will then make that referral to Bridge to Wellness and have the students go on that side of the house. So that is absolutely uniform. I was speaking more about the consent and trying to, through that consent process, open up the availability of the programs for as many students as possible.
So just to follow up on that, and I'll turn to my colleagues, so talk about the decision of how a student is identified. And it sounds like the social worker is the one person making that decision. Or no, could you talk about that a little? What's the decision tree? Like, how does it filter down? Obviously, we talked about self-referral, but how does, please.
Good morning. First of all, it says say your name. So Hope McGuire. I am program manager, student engagement, behavior, health, and academics. So I'm the liaison with not only Bridge to Wellness, but linkages to learning and the other services with SCYS, along with Excel Beyond the Bell.
Before you answer, because you're going to answer the question, to the point of how many we're getting after this process, like what are the things that are holding it up? What's the bottleneck? And is there one as you identify it? How people are getting identified?
Yes. So there's 3 ways for referrals. The student well-being team is where anyone within the school can actually refer a student because they see a concern. And then that goes through the student well-being team. If they select through the student well-being team that they think that Bridge to Wellness will support that student best, then the social worker is the one who then communicates that to Bridge to Wellness.
So who's making the determination of the intervention?
The entire team. The entire team. That's one way.
They meet and say, student X, they think they would be a good candidate for this intervention.
Yes.
And that gets passed on to the social worker.
Yes. The social worker then meets with the Bridge to Wellness teams to tell them, hey, we have some new referrals. They have access to their referral sheets on a regular basis. They check them daily just to make sure that they are keeping up with anyone who's been placed on that. That's one way. Then students can refer themselves and go directly to Bridge to Wellness and say, I'm interested in these particular services, whether it be care manager, the mental health specialist, or the youth development specialist. They have
talked about how we could do a better job and will do a better job of getting that out. That's your job, to get that out to students so they know what's available.
Yes, and I'm about to get to that one too for you. I got you. And then the last one is parent referrals or caregiver referrals, because someone might actually see that we have some parents now who, in all transparency, I'm the mother of young adults. You might see that someone else needs to tell them the same thing you're saying because they'll receive it better. It's the human element, right? So one of the things with that is parents can do that same thing and they can come in and have a conversation. So what we've done to address this in these 6 months, and I want everyone to realize the human element of this, that 2 things can be true at the same time. Within 6 months, Bridge to Wellness staff has actually had to gain trust of everybody, if we think about this. They had to gain trust of the staff, they had to gain trust of families, but the most important factor is trust of the students. So that does take time to develop, to make sure that I feel comfortable even coming to you for these services. So in our 2 shared learnings that we've had, one in October, one we just had this Monday, we actually unpacked what it takes to actually engage young adults. Some are young adults in age, and then also adolescents in the sense of teenagers and how they will feel comfortable with you. We also talked to them, and I personally shared from a parent perspective how to engage the families to know that you are a partner and that you're not an adversary. Because a lot of times it comes out of fear of what happened to them when they were in high school themselves, or why they might not want to access any of these services or encourage their child to do these services. And then the other piece we have to also bring in is that some of our students feel it would be a burden if their parents knew why they were going to get these services. And we don't really talk about that a lot of times. A lot of the students are feeling like I would be adding more stress to my parents in that sense. So that's the other part that goes in to the consent piece that we really are trying to navigate around, working with what the state says, working with building that relationship with parents and their child to go through these processes. So those are some of the things that we're trying to address. One of the other things we're doing is Kirsten and I actually go and do site visits, and we talk directly with the staff within those buildings to see what is going on in the 19 buildings. We have just started, but one of the things we will say is even though the referral process is the same, each entity school is different. So their cultures are looking at things from different perspectives. We have one school where the kids really want the services, but they don't want to miss out on class because they have a very heavy caseload, a course load, and they don't ever want to miss class. So then we're talking about how can we navigate additional time, like does that particular staff come in before school stay a little bit after school? Should we look at how they actually staff things during lunch, which is how we get most kids, is this open time to come and just talk, let us tell you what we have, and then you pass this on and say, hey, if you want to come back, feel free to, fill out our forms and, talk to your parents, or if you want, we can talk to the parent together and trying to get them to do that as well. So a lot of this is the human element of trying to build trust within 6 months of rollout of all things, when implementation usually takes 2 to 4 years.
Sure. That's helpful. And then on the consent process, I think, how many people, different contractors do you have across the schools?
We have 3.
Okay.
Just 3. No, 4. Sorry, 4. 4 for Bridge to Wellness.
4 for Bridges.
Yeah.
Not for other services. Yes, Ms. Triplett.
I feel like the question you were asking was less about the process of how the referrals, the process of the referral pathways, but more around the decision making in terms of
Right.
how we decide, because there's a
Who gets one
plethora
intervention.
of a menu of services for MCPS, but we're not part of that, of the committee that decides the referral. So I would also be interested to know sort of like what are the drivers or of making the decision of this child goes here versus here.
Yeah, I would too.
Is that correct? I'm sorry.
Yeah, you're bouncing the question off of me, clarifying my question like you did for Councilman Brown.
Yes.
Exactly right. So, yes, can we answer that? I was trying to get at that, like the determination of what service, who goes where.
So the student well-being team is composed of multiple state positions, and actually Steve Neff is behind us, who is actually director of PPWs. And with that, they have the pupil personnel worker. You will have the school social worker, counselor, administrators. You also have the resource counselor. Sometimes they will invite Bridge to Wellness in if they have already started a case to be a part of that, to support in giving updates on that. And based on how they have seen the engagement with Bridge to Wellness, they might say, yeah, we have someone similar. We think that this will actually benefit. And so they actually have a whole discussion around the different factors. Another factor that I would like to highlight that is positive about Bridge to Wellness is the diversity within the staff of all of our Bridge to Wellness. It mimics the demographics of our population of students within our high schools, which is a very good fact when you think about a lot of times they don't see that in their classrooms for instruction, but when it comes to these services, they do. So a lot of our staffs are very diverse, whether that be male, female, non-binary, ages, experiences, and even race and ethnicities. And so that has helped a lot with also navigating when they're making those referrals over to Bridge to Wellness, where they think that might actually build trust in that relationship for those services. So it's actually not just about, the social worker only works on this. If maybe that mental health therapist does too, and then it goes into the next factor of looking at, okay, so who do we think, based off of how this child engages with other staff members, they might be more comfortable with. So it's more than just some of the basic checkoff parts.
A couple other factors. So it really depends on what the student is referred for. Right, so the student well-being team we're not just referring students because there's clearly a mental health, right, or well-being issue. It could be disengagement. It could be a change in behavior, an unexplained change in behavior. Student came to my class, they were fully engaged, they have been for the first marking period. Now they come sporadically. When they come, they look very disengaged. What is going on? We're not sure. It could be attendance. It could be some behavioral issues. So if it is a need that is best served by our Bridge to Wellness staff, it may go there. Our social workers' caseloads may be full, for example. It may have to do with something the student needs mentoring, right? They just need somebody in their life who can provide, be a positive role model, who can be consistent with them, and that's why the youth development folks are there. So it really depends on the need of the student. We'll also say in some of our communities, parents are able to provide their own services for students. They are able to get private therapy or get what they need. So we may speak to the parent, and the parent says, I'm going to take care of that, right? I'm going to make sure my student has what they need. In some of other communities, the parents may not be able to do that. So now we have our services in Bridge to Wellness, which are plugged into the school. I think one thing, again, although it's been 6 months and building the trust is there, when you have a school community that the parents believe in and the parents feel strong and comfortable about, my experience as a former high school principal, informs me that the parents are more likely to engage with those resources that are in the schoolhouse. And so that has been very, very beneficial. So they do not have to navigate the labyrinth of resources outside of the schoolhouse. It's a one-stop shop. So I hope that clarified a little bit.
No, it does. It's helpful. Thank you. And obviously, 6 months in, more collaboration to do, and make sure that we want to make sure we're catching and identifying and referring appropriately. So appreciate that. I'm going to turn to my co-chair, Councilmember Albanaz, then Councilmember May.
Thanks.
So first, please extend our deepest appreciation to the folks that are on the ground doing this work. It is so critical right now, and I know they're exhausted and overwhelmed, and the caseloads can be overwhelming at times. And they're trying to build a bridge as they're or plane as they're flying it, bridge as they're driving over it, I guess. So just in 20 years ago, I would have been one of those contractors in the schools working directly with the youth. But and you noted, understandably, that it was a big transition in a short amount of time. And we had to onboard staff. The staff had to get acclimated to the schools. They literally had to find out where the restrooms are and get to know the administrators, get to know what resources were already available to be able to make those referrals. But it's challenging in a situation like that to establish trust among some of the providers themselves. And I'm glad to hear there was a meeting recently to talk about how to coordinate those efforts moving forward. I assume we are, but can you confirm, are we institutionalizing those meetings so that those various providers, the number of contractors that we have on board now, can meet more regularly and be able to share notes, compare notes, talk about cases, make referrals, and build that trust?
So I meet with actually in the fall, I met with the supervisors of the contracts. I met with them weekly. Because it was so new, there's so many questions, there's so many things to work out, there's policies and procedures and stuff like that. I now meet with them twice a month, so that we do have the regular meetings with the directors of those contracts, because it is a unified effort. It is not competitive, so it's making sure, and we were very intentional from the beginning to make sure that the services were uniform, so that all the directors for the Bridge to Wellness from the different contractors were hearing the same message, were implementing things in the same way, had the same flyers that they were distributing, and all of that. And so, yes, that has continued so that we're still meeting twice a month.
Thank you. I appreciate that. And I appreciate Ms. Treadvance's clarification of Chair Jawando's question. That link does need to happen, though. So, more seamlessly between HHS and MCPS, because you're both dealing with the same student and are both in a better position to be able to holistically serve that student if you each have the same piece of information. So I think that's important moving forward. Ms. McGuire, you mentioned, and you're so right, and you said it very eloquently and diplomatically, that every high school administrator in every school certainly has different needs, but the administrators of those schools have different means by which they manage their schools. And we've got a former principal here as well. And, I remember vividly being in the youth development space in 12 different schools, same program, same staff, but the manner in which it was administered in each of those programs depended largely on the support that we got from the administrators of those schools. And this is a challenge for the central office, because you can put a memo out, have meetings, encourage, but there are some schools that embrace and others that not as much. So talk to me a little bit about how we are working with school administrators who, to be fair, have on a good day 1 million things on their plate and are drinking water out of 5 different fire hoses.
Oh, yes, absolutely. So what we and Ms. McGuire can speak to the details, but what we do is we plug into existing administrative spaces. So our high school administrators meet on a monthly basis. And they're there all day. It's an 8-hour day. They spend their entire day. And central office folks plug in and share information, come to some action, give best practices, and speak to protocols. And so this has been a key space for us to leverage that type of implementation. And Ms. McGuire can speak to that in a second. But beyond that, I sit myself on a team with the school supervisory associate superintendents. There are 3 associate superintendents that supervise all schools, and there are 9 directors of school support and well-being, 3 under each of the other associate superintendents. So while I do not supervise schools directly, and I work with our programs that cut across schools, there is a horizontal alignment between myself and the associate superintendents who do. So whether it is Bridge to Wellness, if we're talking about restorative justice, if we're talking about suspensions, if we're talking about a programmatic approach that cuts across all schools, that is the connectivity point there. And then we work with the school supervisory directors to implement and try to decrease the variability. That is the central office model for how that works. And then I can let Hope speak to the work she's done directly with the principals.
So I go back to my time as a teacher, and so I believe in differentiation, but I really do adaptive support. So I have started to learn all of the administrators that have the 19 Bridge to Wellness, and I am a part of administrative and supervisory meetings, so A&S. So I literally will go up and have already looked at your data, talk to your staff, talk to your social worker, and I meet you where you're at to say this is how this can help you in your school. I can come out and speak to your PTSA cluster. So I was so excited to hear that we were talking about Poolsville because I literally talked to them Monday evening for their cluster meeting for their PTSA and talked to them about Bridge to Wellness and the different supports, and then also stayed on the call and gave them actual solutions for some other things that were happening. I do those kinds of things where I will actually go speak to the PTSAs. I will actually go speak to the administrators within the building, and actually I'm speaking next week to the resource counselors that are in the high schools and giving them an update not only on Bridge to Wellness, but how Bridge to Wellness actually lives within our anti-racist audit data and how they can actually merge that information to actually bring solutions to their schools. So it's very technical, but it's actually getting everyone to understand how you can plug them in where they're an asset to your school and they're not an additional thing that you have to worry about, because you can actually just call me and other people can help you do that.
That's great. Again, referring back to the panel that Chair Jawando and I were on last night, there was a student, they were all amazing, but there was a student, the question was posed, do you feel comfortable coming forward at your school if you know that you or your friend is having a substance abuse issue? And the student in real time said no. Didn't know where to go, and then started thinking about it in real time and is having this conversation out loud, and then ultimately said, well, I would probably go to my teacher because I have a relationship with my teacher. And that tracks with what we've been hearing from our incredible teachers, and not just teachers, but coaches, bus drivers, support staff. Kids are going wherever they can and wherever there's some relationship with a caring adult willing to listen to them. Can you talk a little bit about the referral process beyond the providers themselves, but among teachers and administrators? Are they encouraged? Have they been briefed on the services and how they can connect students to them?
Yeah, I'll take this, and if Mr. Neff has any, if I'm missing anything, Steve, feel free to hop on up here. But what you, so at all of our high schools, they all have like a Google referral form that is available on like the digital hub for the schools. So where all of your resources are for your entire staff, all your forms, all your links, all your agendas, right? Schools have an electronic hub where those links and those resources are. Most of the time, the referral form is linked there. It's available for staff. It's very short, very simple. And it asks, and I love that you referenced it could be a teacher, it could be a bus driver, it could be a coach. And that also tracks with what we are messaging to our school leaders about ensuring that every student has a trusted adult in the building, no matter whom that trusted adult may be. It could be a security specialist, it could be a main office secretary, it doesn't matter. All staff have access to this form. And if it is there are usually questions about like what tier 1 supports. Did you talk to the student? Did you coach them? Did you have a conversation with the parent? What have you done right before you're referring? So we're getting some information about the work that has been done. They are then referred through that form. That form kicks to create, it feeds into a spreadsheet, a Google spreadsheet, where we are tracking every single student. We can see who the student is. We can see essentially their grade level. We know if they have special services, right, that are being provided. We know their student group. We know the reason that they are being referred. We know from who referred them. Then goes into this spreadsheet. That spreadsheet, and this varies from school to school, But that spreadsheet then is used. That is the tracking system in the student well-being team meeting. And so when the professionals come together, the student is referred, and it could be substance abuse. It could be anything. And that is where that team then triangulates around that issue and then makes the specific referral. I do want to note one thing. And Steve could speak to this. We've had this past, because of that variability in the data monitoring, right? Because this is new, we trained all 210 schools on a new data monitoring system in our student information system, an MTSS, or multi-tiered system of support for students, so that we are now able to not only see who are we referring, why are they being referred, and what did we do for them, but we will be able to see who we're referring, why they're referred, what we did for them in the intervention, and whether it was successful or not, and why. And so this is a brand new system. Again, trained everybody first semester, and we are doing a soft rollout second semester. And so really, to your point, we are coming forward to all of our staff to codify this. This summer, we're coming out, we are producing in real time right now. We're working with a variety of stakeholders across the district to put forward really a standard operating procedure guidebook for all of our student well-being teams. How often you meet, who should be on the team, what the best practices are. We're elevating best practices in schools to have a resource bank, and part of that will be information related to the new data platform. But again, full trained, 210 staff, and we'll be able to track this in a really, really, I think, cutting edge way, starting now, but really uniformly by July 1.
Thank you. I appreciate that. Final question for me. I know other colleagues want to speak, and it's almost lunchtime. The number of student absences. There's some shocking data. This has been, unfortunately, one of the terrible byproducts of the pandemic. And obviously, each of those students has their own unique set of challenges and is hurting in some way. How is that being connected to this work?
Good morning. Steve Neff, Director of Pupil Personnel and Attendance Services for Montgomery County Public Schools. That is a great question. It is accurate. Our data has shown that we haven't recovered from an attendance standpoint from the pandemic and the impact of the pandemic. And the challenge that arrives at us is that there are so many different factors. And so we're looking at a comprehensive chronic absenteeism action plan that addresses many of those factors. And really one of the primary ones is if we think about the results from our anti-racist system audit, and we see across the questions that are asked and across the folks that were interviewed that our African American and Hispanic families don't feel as welcome, don't feel as informed, don't feel as valued, seen, and heard, it stands to reason that they would not send their children to school as frequently as others. And so one of the things we need to know we need to do systemically is make our schools, more welcoming. But in terms of other root causes, definitely mental health concerns are a challenge. Definitely, we're talking a lot about our high school students. There are unique family responsibilities, needing to work, needing to take care of younger siblings. So we also have a responsibility as a school system to look at what are our other options for educating, for students to get themselves educated that might not involve sitting in 7 different classrooms from 7:30 in the morning to 2:30. And so you're right, there is a chronic absenteeism challenge that we are looking to address. And Mr. Montiglione mentions, multiple stakeholder groups. I was looking yesterday, coordinating like 5 different work groups around attendance that are feeding each of a different area of attendance that we're looking to pull together.
If I could just add, I think what Mr. Neff is saying, there's really 3, and again, this is a real-time plan, and we are working to come forward with this and have a draft by I think the end of March, but it's really 3 areas. Why aren't students coming to school? What is not drawing them, right? Why aren't they coming? What are we not providing, or what is our climate or our culture in our school about that is saying to a kid, that's not really a place that I need to be or want to be? And that's where that anti-racist audit data speaks to that. The other piece of that is I would say that we are at the cusp of a place we need to really reinvent and think about how our high school students can earn graduation credit outside of an archaic institutional process. Our students are in a world, there is no other place in your life where you will be doing something for 8 hours a day, and it will change every 45 minutes, and you will have to raise your hand to go to the restroom, and you have to take graduation requirements that may or may not be within the spirit of what you want to pursue after high school. Luckily, the blueprint from the state of Maryland provides some opportunity after 10th grade to really allow students for a little bit more choice. We have to be creative. If a student does have those family obligations, right, at home, or if a student just doesn't need to sit in a class all day because they have internship opportunities, they have work opportunities that possibly could give them credit, we really have to work with the state of Maryland to figure out how other avenues to earning those graduation requirements can be met so that we can have a schedule for students that is flexible. Some students, 7 period day, fine, absolutely. But we have a model of education right now that does not fit the reality of the needs of our students. And that's just a fact. And I think the attendance that we're seeing right now is really a confluence of these things, an outdated model, the fact that we have some of our schools where some students don't feel welcome, and also the mental health concerns coming out of the pandemic. And students got used to an alternative way of earning credit during the pandemic. And honestly, we have some students that are kind of choosing their own virtual academy right now, right? We're like, I can earn this credit and I can go online and everything's on Canvas and I can submit my assignments. And do I really need to show up to prove that I can earn credit in this class? So these are big questions, and there isn't just a simple fix to this. This is a deep-rooted question, but we are putting forward this multi-pronged plan to try to address each of those 3 major areas right now.
Thank you, and I'm glad you brought that up. And I'm going to turn to Councilmember Mink next. I mentioned this to the superintendent the other day, the attendance issues, and what I'd like to do is come back after budget and have a session that combine them for us already, attendance, an update on this issue, on the mental health issue, and also on the anti-racist audit, because I think that's something that we just haven't engaged a lot with since it's come out, and I think you'll have some more in the spring to talk about what you've done, and I think those things all interrelate, as you just interrelated them here. But on the attendance issue, I'm glad to hear that there's this work group, because you're right, there are different pockets of why people aren't attending, but I do think my view of touring these schools and talking to kids and families is there's a large group of students who have been disengaged, who aren't doing well, and it's not just the high schools, it's middle schools, and we have an issue there where in the middle schools you just have to promote, and then they get to 8th grade, and if they haven't been going to school for 2 years, and we're 2 years into the pandemic, that we're going to have some serious issues coming into 9th grade where it does matter then, and when you can start retaining and holding back. So I think we need to get ahead of that. One of the things that came up when we were at Gaithersburg Middle School the other day, Councilmember Katz and I were, do we have enough PPWs? Because one of their roles is to go out to the homes and see what's going on, right? And so that would just be my kind of just one specific question, now I'll turn to my colleague. Do we have enough to do that in light of where we are with the attendance crisis?
So it's interesting, if you ask the Director of Pupil Personnel Services if he has enough PPWs,
Softball.
Yeah, right. No, I mean, of course, there would be a benefit to add PPWs to reduce the number of schools that each PPW would have and give them more opportunities to be out into the community. So, yeah, of course, we could use more PPWs.
What's the
We have 54 PPWs, 210 schools. So each PPW has a 3 to 4 school assignment, and that varies based on the needs of the school and the needs of the community. I do want to articulate, though, that PPWs, we talked about Bridge to Wellness staff in collaboration. We also have a significant number of staff members, parent community coordinators, emergent multilingual therapeutic counselors. We have, community school liaisons. We have had an influx of those community and parent-facing staff members that PPWs have interfaced with to be able to, accelerate and expand the outreach in the community. Because you are very right. There are many times when families can't or won't get to the school to meet with us, and so the only place is, in their communities, in certain centers, at their homes, at their workplaces. So it is definitely accurate that the more we're able to be in the community, the better we're able to try to engage students and families back with their schools.
Well, I appreciate that. When just the staff will come back and talk about these issues and the interplay, but I think we have a cliff of sorts coming with, and we're dealing with a crisis right now, but I think it's going to be multi-year. This isn't going away. So, Councilmember Mink.
Thank you for that great conversation. Although it's a little tangential, I'm really glad that you brought it up, because I think as we move forward with this conversation, I think that's a great idea around how to keep our kids engaged and in school and address this attendance issue. I do think that it would be a mistake for us to say, if we just have the right consequences in place, if we just fix, this little technical thing or that is not how we're going to address this systemic issue. It's much, much broader than that. We do have an archaic, system in place that has not been updated, and we're living in a very, very different world now than we were a year ago, much less a century ago. And students are looking for something that really is going to prepare them for today's world. And we are honestly not providing that. There's not a lot of school systems that are. And so this is definitely an opportunity for MCPS to reclaim that mantle of being leaders. It's an exciting opportunity. I don't want to scare our teachers who are already obviously overwhelmed and overburdened. They should be an intimate part of this conversation moving forward. They're in the classrooms. They know what engages students. As you know, as a former teacher, and I was myself as well, but certainly finding ways to make this much more tailored to their interests, to their needs, and to the workforce opportunities that await them now, which is very different now than it was even a few years ago. This is going to continue to change. So it's an exciting opportunity. I look forward to that conversation. Okay, a couple questions on this. I am curious, the menu of options that that students receive when they come into contact with these systems, does that menu include options that do not require parental consent? And I mention that because there are some students, it doesn't matter how well you get to know them, they're never going to want to loop their parents into that conversation. And some have very valid safety or privacy reasons for that being so, and we need to make sure that we are attending to them.
I'll just do the one for Bridge to Wellness, and then I'll let MCPS answer the rest. So under Bridge to Wellness, for licensed therapists, students can provide their own consent for it. So for therapy services, so for care management and youth development, no, currently they do need the parent guardian consent, but for therapy services. So the law is 12 and older. It's usually going to be, if they're 16 and older, is when they're most likely, usually when we'll allow them to do their own consent. The law does allow for younger ages, as you said, for if there's safety issues or it just would really not be in the student's best interest for their family to know about that, and they really do need those mental health services at that point. So under Bridge to Wellness, that's what they could access.
Okay, so can you clarify the 12 and 16 thing?
Yes, sorry about that. So the law used to be, to consent for mental health services, the law in Maryland used to be you had to be 16 and older to provide your own consent without a parent guardian knowledge or consent. A year or two ago, they lowered it to 12 years old. Really is kind of the exception for a lot of times for LGBTQ kids who were their families just either it's unsafe for their family to know that maybe they're exploring gender identity or sexual identity, and so needing those services, or maybe dealing with suicidality and the family is just absolutely opposed to mental health services. So it It lowered the age, again, more as an exception for circumstances where that kid really, really needs it, and it's just completely unsafe for the parent guardian to be involved with it. Best practice in mental health services for any youth is to involve the family. So usually most of the practitioners and the agencies who provide the Bridge to Wellness services, most of them have remained at that 16 and older, because the student has to be mature enough to really provide an informed consent and saying, I understand what I'm consenting for and what I'm doing. So a lot of them have stuck to the 16 and older for that. They're definitely mature. It's pretty used to that. And then anything under that age, it's a new law. There's not a whole lot of guidance on it. The school system has not determined any guidance on that either. So they'll usually look at those that on a case-by-case basis for 15 and younger.
Okay, thank you for that. All right. Feeling like I've got a lot of flags here. Okay, so what is the, okay, so I realize it's a new law, so I don't know how well we can answer this, but like, what is the legal standard? I have some concerns if we're leaving it up to the provider to be like, okay, this kid is LGBTQ, and so now I'm going to let them know that they can access this service without parental consent. If it's not, this seems to me something that it should be student opt-in. If legally all we need is the age requirement, a lot of these kids aren't going to want to share this personal information until they know that they are not facing a parental consent situation.
They can explore, so at an intake or an initial interest session, the therapist can explore what their interest is. Usually, we usually get parental guardian consent for this, and the student has a chance to really explore with them or say, these are the reasons not. And so that the therapist isn't just doing they will explore all the issues to really make a determination, a clinical decision.
I mean, you said parental consent is needed for that session, though?
No.
Okay, is not needed for that session?
Yes. If the student comes to the therapist and says, hey, I'm really interested in services, the therapist will explain the process about it. So normally we get parental consent. Do you have any, any questions about that? Any issues? Kids like, no way. These are some of the reasons. So that person does get a chance to explore that to really make that clinical determination for it. The law does state that the therapists are not required to accept a self-consent from a student. So the therapist has to make that clinical determination is what the law says. So it's not like just because they're 12, you have to take them if they say that they want to. There has to be a clinical determination if they're mature enough, if they can make the consent themselves. There's a lot of nuances to it, and it's not a very simple cut and dry. You're 12, you can give consent now, and everyone should accept that consent. The law does include that clinician making a clinical determination of that student being mature enough, that situation warranting it.
So from school to school, there could be very different experiences. If you have one clinician who is comfortable with leading with, if you don't want to tell your parents, that's okay, we can go that route. And there might be another who has, for whatever, liability concerns or a feeling about best practices, who's leading with, what are your concerns? We're planning to do parental consent. Any issues with that? Like you're going to get two very different responses from a lot of kids there.
So the agencies, there's just 3 agencies who are providing the Bridge to Wellness, and they all have the same kind of guidelines to their staff who are providing those services. So it is pretty uniform. So the agencies will work with their staff on this is kind of how our agency is not interpreting, but how is implementing this law. So it's not just going to be an individual therapist like, yeah, I really want to do this. They work with their clinical supervisors and the directors at the agency, and the agency will have a uniform method. And in our meetings, as I said, we meet regularly. We've talked about this consent frequently, and so everyone is generally on the same page about it. So it is really not a school by school or even clinician by clinician.
But I do want to offer that that's just for bridges, right? So because this is a law, we don't know how it's being implemented by other providers out there. And I think what I heard you saying was, it's just like an equity thing, like centering the child. Like, do you know that this is now one of the rights that you have? Like, and being just public dissemination and information that like, this is a shift, just know that this is available if you ever need it. It's right there. I think that's what I heard, more than just of how it's implemented in one program, but just more across the board. Like, are we, and I don't know, because again, this is a law, like this is way bigger than just our programs, but maybe we could talk through how we align that practice for this law across some of our interventions.
Thank you. Yeah, exactly. And I'll move on shortly, but I think this is a really important conversation to come back to, because a huge theme of what we've been talking about today is the barrier that is there because of requiring consent. If the law allows us to lead with, we don't need to involve your parents in this if you don't want to, I think we should be leaning into that, significantly. And then you can leave it up to then the relationship building between, the provider and the student to be able to have conversations about the benefits of bringing in your parents and them assisting with that, that whole thing. But if the law allows us to, and it sounds like we're not exactly sure here, and there might be liability concerns on the part of the three, the groups we're contracting with and so on. But if legally we can do that and remove that barrier, I think we should absolutely do that. Yes, I think we should definitely do that. And then, let's see. Okay, in terms of getting the word out, I am concerned that we're like 75% through the school year and it's still such a struggle. And I mean, part of it might be, I don't know what the balance is between getting the word out and people knowing and people having concerns about things like the parental consent, and so removing those barriers would certainly help with that. I did hear, a lot of good thoughts about getting feedback from families that might indicate some of those issues, like equity issues and the consent and so on. But I'm wondering how we are involving students in this process. Are they on, the comms team with this? I feel like that could be really helpful.
Are you speaking to Bridge to Wellness?
Anyone who has thoughts on this is
Okay.
welcome to chime in.
So I'll just speak to Bridge to Wellness, because one of the things I do want to highlight, on Monday we did Job-alike sessions. And so a lot of them have already actually communicated very well with engaging the student clubs that are in the high schools. And so one of the things they said is bringing that student voice in. They present to the students and then have the students give them feedback on how do you think we should be able to do this with other students that are in the building. So a lot of that has helped. I can only highlight, I know for tonight, for instance, I'm going to Walt Whitman, and they have a club that's literally working with the Bridge to Wellness to bring an activity to actually have something there. So it's really us getting the Bridge to Wellness staff to highlight all the student clubs, get involved with the student clubs, do interviews with the student newspapers. They have flyers, so getting the flyers out. We've talked about being very creative with how you even put the flyers out. I still believe in old school, sometimes the paper on your car where everybody looks and say, oh, what is this? And then they take a moment to read it. And then other ways that we could actually put it out in communities. So there are some communication. And then we also presently, Kirsten and I work very closely of what we're thinking about doing, planning now for a big summer rollout. We're doing some very creative things with communicating this out.
Add to what Hope said, is that they are doing all of those things now. So they have been doing them, they continue to do them, they will continue to do them. And one of the big things is they've also been doing a lot of open lunch in the conference room of that space there. And so just having an open lunch, and so all the staff are there and they can meet them and interact with them. And then, ones come and like, oh, this is really cool, and they bring their friend and they bring their other friend, and you might want to meet them. And so it's all going on. Yeah, I have one person, she's like, I've been in the student newspaper twice now in the interview about me. So, but there's a lot of people.
Yeah, I hear that. That's great. That's great to hear. I think
And it is the
students are how we're gonna.
The students and the
It's the
parents,
consent.
it's a consent.
Okay, so we need to
We're
figure
gonna
out the
work on that about
legality.
the readability, and as you said, the law.
Okay, that's great. Thank you. And I'll just note also that in terms of reaching the teachers, you were mentioning how the teachers, everybody has access to that forum, which is so important. Teachers are the ones who have those relationships. Similar to like we were talking about for the students, I think it's really important for the teachers, for everybody to not just have access, but that we're being very proactive in making sure that all of the teachers know about and are excited about this, and that they're using this tool, and that we getting the referral numbers we should from the teachers. Knowing obviously, again, our teachers are very overwhelmed, but a lot of that is because they're dealing with these issues with kids and they don't have capacity for it. So if they know that there is a safe and quality handoff that they can make, I think that they will use it. And so just making sure that all of them know and have that bookmarked on their laptop or what have you. Can I do one more quick question?
Yes.
Thank you. Okay. Just wanted to find out, what is PYD's role in crisis response situations?
I will have to get back to you on that one because my beloved Luis Cardona,
Okay.
he knows more about process. I'm not intimately involved in process, but we could get back to you. However, the formal, for HHS, not just speaking for my service area, the crisis response is handled by the service area of behavioral health. PYD is involved in a completely different spectrum when it's something that has to do with like an adolescent, or things of that nature. So I could go back to the department so we could give you clarity and information on what's the formal crisis services for the department, and then PYD's role when it's niching down specifically to students.
Okay, that's great. Yeah, because I know we have an unfortunate number of crises that we're facing, and we want to be using all partners and making sure that MCPS is really, integrating with and pulling in partners at all of these different moments. We're not missing any opportunities.
And one thing I want to clarify, which is something Dr. Burgess and I are going to be working on, and along with Luis. So Luis Cardona's shop is called PYD, Positive Youth Development. But positive youth development is diffused across the board. Everybody does it. So I just want to clarify that there's MCPS does PYD work. We do PYD work. So when I get back to you, I just want to state clearly, we're going to rebrand. It's been a problem. To clarify which programs under PYD are the ones that respond for specific situations. And I think that will be a little bit more clear on paper. So just wanted to kind of offer that. It's one of the weird quirks that we have, that we're called PYD, but it's a practice that's owned by everybody.
Thank you.
Great point. Collaboration Council, a whole bunch of people, yeah. So, and just a note, we set this tone at the Education and Culture Committee hearing, but obviously Councilmember Avenaz is on that committee, so I know he shares my view here. When we do come back, I'd like us to have a presentation and be very data focused on the update. We're going to be looking for, okay, what have you done? You said you're implementing all these things. What are the numbers? What were they when we first met? What are they now? What's working? What's not? So I would just ask that when you come back, we're very focused in that way, in responsive to these questions, and staff will help remind you when you come back that yes, go ahead.
Yeah, yes, Councilmember Joando. It's interesting. As we were talking, we had a board presentation, and I'm going to just verbally share some numbers. We're happy to bring them back. So on February 7th, so as you were speaking, I pulled up the presentation. So just for the how many students have been referred to student well-being teams? 6,529. Out of that number, 3,285 are Hispanic Latino, 1,792 Black or African American, and then the numbers are smaller. But I also want to indicate that 5,349 of those 6,529 are farm students. So a key number there. There's also just some other data to share briefly. Our social workers, our full social workers have been implemented. No, this is and this is available. We're happy to share this with you, Essie. If you want to get this, I can share this with you before I leave. It's a public document from one of our recent board meetings.
Sorry, would it be possible actually for us to all get that data? And
Sure.
If it would be possible to get some of these, demographic and farms and so on breakdowns, just the full spreadsheets, so that we are also able to sort and look at our districts and do comparisons. I know that data is available publicly, much of it. But it's in PDFs and we can't sort it. So if it would be possible to get that, not only for our staff to be able to do that, but for us, that would be tremendously helpful. Is that possible?
Yeah, I don't have that right here in front of me, and we would have to do it. That would probably go through the transmittal process, right? And then we'll be able to bring something. I don't at my disposal have all of that, but
right, not like right this minute. I just want to know that we'll be able to get that.
I would just say offer from my seat here that we just go through the process when we engage.
Okay, thank you.
There's a couple other pieces here. But 2,604 students have this is as of about a month ago, have had service from our social workers, and 444 through that process to Bridge to Wellness. And looking specifically at Bridge to Wellness, we have the top 6 reasons that students are referred to Bridge to Wellness: emotional dysregulation, a history of trauma, family conflict, social connections, friendships, anxiety is 5, and then depression. 60% of the students who have been referred to Bridge to Wellness are female, 1% non-binary or other, and then 39% male. Could break it down some other data for you in terms of ethnicity, but I just want to say that we are tracking this data. We are looking at the impact of the financial investment that you all have made in MCPS. We are grateful for it, and we know that we need to ensure that we are making an impact, and we are tracking this data daily in real time.
You did a great thing. You set the baseline. So we'll be looking, to hear more when we come back after budget. I'm going to go. Yes, go ahead, please.
So that is the referrals from the school well-being team. And so in your date, you pulled the numbers, it was a little bit before mine, but through February 10th, there's been a total of 928 referrals to Bridge to Wellness. And so that includes the self-referrals, parent-guardian referrals, and the school well-being team school referrals.
So what was the number for 600?
So I was the number that I gave you, 493, were the student well-being team referrals to Bridge to Wellness.
Another 400 or so. Yeah.
And my date's a little bit later than his. I think his was in January, and I pulled mine on February 10th. So a little bit more, but yes. I want to give you the bigger picture of all of the referrals.
Councilmember Sales, I think, were you next, or do you want to go after Councilmember? Okay, Councilmember Sales, and then Councilmember Lukey.
Yeah.
And we'll wrap. We're going to be out of here by 12:30 or sooner.
Thank you, Mr. Chairman. Thank you for the update on the Bridge to Wellness metrics. I don't know if you you mentioned the racial diversity of the students who are accessing the services. Can you speak to the racial diversity of the staff across our wellness centers, and any data regarding the student experiences at our wellness centers?
You just clarify, it's Bridge to Wellness, so that we're
Bridge to
confused
Wellness.
with the wellness centers, which are what Mark was talking about earlier. Just
Bridge. The Bridge to Wellness centers.
BTW. By the way, it's BTW. Sorry.
Yeah, the Bridge.
Sorry about that one. Yes. I do not have, so they are contracted staff. I know we did pull some stats, which actually Hope might have that of a self-reporting of staff demographics, and I haven't pulled the demographics from
While you're looking at that, I can ask another question. Given that Bridge to Wellness is responsible for determining what services it can and cannot provide, when they identify what they cannot provide, what does the well-being social worker do with that information?
I just want to clarify, oh, sorry. It's your question, but the wellness team, we're one of the plates on the menu. So when they refer, we always serve. Or do we ever reject a referral back?
We will assess.
Okay.
Yeah, because sometimes the student may not want it, the family may not want it, so there's sometimes where the student's like, nope, I actually don't want this, or sometimes it's not the right fit. So I will give one example. So our mental health services are focused on those who are underinsured or uninsured, to really prioritize those. If the student who's referred does have insurance, our care manager will actually work with that family to link them to a provider under their insurance. So we'll still serve them, we'll just hand them off to the other person to make sure that they're getting those services through the insurance that they do have.
And what about the uninsured?
So uninsured for mental health, so we serve the uninsured or underinsured.
Okay.
Yes, that is, our mental health is focused on the uninsured or underinsured. So if there's significant barriers to them accessing the services, so maybe they have insurance, but it's a 6-month wait list, the kid actually needs services now. So we may work with them for the 6 months while they're on the wait list and then transition them over to their insured provider. But we assess all of those things when looking at the mental health services. But yes, very specifically uninsured, definitely.
Thank you. And how quickly do we provide services to students once they've been referred? Students been referred, how long do they get into service? Next day, next week, or?
Yeah, so the staff are checking the referral sheet every day. So it'll come in, and so then they will start right away of getting the consents, meeting with the kid, contacting the family to get those going. There's not any delay.
Oh, okay. And how long is the service? Is it just as long as the student needs it to recommend it to?
Yeah, there's not a time limit
Okay.
on it, so it really will be based on the needs of the family or the student, depending on what the service is.
Okay, and this may be the question
Yeah,
that,
I was gonna
okay, about the different numbers
Yeah,
of,
I'm gonna
okay,
ask that.
all right, so that's.
Thank you, Ken.
Thank you.
Councilmember Sills, Councilmember Lukey.
Thank you. And yeah, I'd left some notes in case I wasn't back yet. But you just raised a point that I wanted to dig a little deeper on. So since the state changed the law back in 2021 with respect to consent, what are you doing for, you mentioned you get the consent, you contact the family. If a student comes or they're referred for service, they may have private pay insurance, but there may be a familial situation there where that's not accepted, right? Mental or behavioral health treatment is not accepted by that student's family as a therapeutic need or a valid, as a medical condition. Will you treat those individuals who may have private pay insurance the same as an uninsured or underinsured student?
Yes, a student who is self-consenting without the parent guardian knowledge is considered uninsured because they cannot access their insurance because that would make their parent guardian aware of it.
Right.
So they are considered uninsured at that point.
Okay, thank you. Now my data question that I was going to ask is, in terms of referrals to the treatment that's offered inside the schools, how many of them are coming as the result of either the suicide evaluation protocol or behavioral threat assessment? Do you track that at all?
So if there is a question around suicidal ideation, it does not, there's a whole separate process.
Correct.
So it would not be referred. Now, after the initial triaging, right, if we have a student who we suspect has suicidal ideation, there is a response that is immediate, it is quick, it is documented, and it has been longstanding in MCPS, and it is separate from a referral to student well-being.
Okay.
If after, right, we have addressed the concern on the front end, and it's determined that the student needs ongoing counseling sessions, group sessions, check-ins, it depends on what it is, right? It could be a weekly check-in with your school counselor. It could be that you are on the social worker caseload. Again, it could be that there is a private referral that you're going to do with your family. It could be that it is going to go to Bridge to Wellness. So that is how that piece works there.
That would come after the initial
So
triaging under the protocol.
So if there's a suicidal ideation, we have a strict protocol that we go into where the student is not left alone, the parent is contacted. We have a referral form that we have to guarantee that the student is going to get service of some kind. So we want to make sure that the student is of no harm to themselves in that moment. And after we have gotten past that, then we can provide ongoing service.
And then for behavioral threat assessments, where they are conducted and additional therapeutic treatment is required for the student to safely attend school, how is that managed, or how do you follow up with that?
So that, yeah.
Oh.
This is Michelle Palmer. She's our acting director of psychological services.
Stay here long enough.
Hi, yes, so I'm Michelle Palmer, I'm Acting Director of Psychological Services. Whenever we do a behavioral threat assessment, it depends on the level that the threat assessment is determined to be, and obviously the greater the threat, the more likely we're looking at different things that are outside of the school. But depending on the level of threat as well, and if we're really talking about this is a mental health concern as opposed to an imminent threat to the school building where safety and security and police or fire or whomever would be involved. We may make a referral to the Bridge to Wellness or a wellness center if that's what we're talking about. We may make a referral to a private therapist that is part of arrangements that we have, whether it's linkages to learning or one of our others. We may actually, depending on the level of need, simply use the services within the school building. It really depends on the student and the need. But there is, because there's follow-up after any behavioral threat that would involve that.
I think it would be useful for everyone to know what the scope of that is within the school system in terms of like at the high school level and at the middle school level in particular, the number of behavioral threat assessments that are conducted with respect to our students, regardless of where they are on the trajectory on the scale, most of them are going to be low level, right? But that's an appropriate time for an intervention so that we don't have any further problems. And it may be, adolescents manifest depression and anxiety by being aggressive. So, which is not necessarily the way an adult would manifest depression or anxiety. And so you're going, what's wrong with you? And that's them experiencing that for themselves in a different way than we as an adult might recognize. So I think knowing how frequent that is and how frequent we must do the suicide protocol as well is useful to us to understand the scope of need as a whole. So thank you.
Thank you, Councilmember Luke. I'm glad you're able to come back and add that. It's a really important point. I do not see any other comments from colleagues. Co-Chair, do you have anything to close us out? Well, as I said, we're going to come back, and we have a lot of homework, but it's good homework. MCPS likes homework, I hope. I know they give it. That's exactly right. So, but no, thank you for all the work you're doing. This is critically important. It's an issue we're going to keep coming back to. The built infrastructure for our students, so that they have places and spaces to have safe conversations and to be who they are. And then all these other issues we talked about, whether it be attendance and where they're presenting needs, we're going to come back to them. So thank you. We took the action on the CIP item, and we'll see you soon. With that, we are adjourned.